Hello? 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 Yeah, it's working. Great. We get chat rolling in. Oh, whatever. Actually, I'm not gonna use that. I need to change the thumbnail. I need to change the thumbnail. Okay. Um. I am going to be studying. What's up? What's up? What's up? What's up? How you doing? Thank you for coming by the stream. Just getting everything set up. I'll turn this. That's on.
I'm fucking stupid Margaret. Said I eat dogs, JK.
That's me. That's all right. Oh, I forgot you still have this name. That's cringe. Okay, y'all gonna have to not be like weird this stream because I gotta focus. I'm gonna be studying for my exam. I'm
I'm
taking
fucking stupid Margaret.
a practice test.
Said I am a change to sunshine animations beaming face with smiling eyes.
I appreciate it. I read your name and I was like, who the fuck is that? And I was like, oh yeah. Okay. No. Wish I could skip this ad. That'd be nice. Okay. Yeah, today we are going to pretty much just study. Currently, right now, so this is where I'm at. I'm currently at right now. Right now, I am currently in a position where I am very close to passing my CNA stuff. There's only a certain amount of questions that I'm a little confused on, and AI is helping me really well, actually. So right now, I'm taking a practice exam. I'm gonna do all the practice exam, this one, and just see where I'm at. I know Monday I'm gonna call uh Michigan Work and see if they do a just a hands-on training on everything you need to know with CNA, because I learn better hands-on stuff. Like I'm a good listener. I'm good at visual stuff depending on what the circumstances. So, with that being said, this is what I'm going to be doing. So while I'm studying, I could stream it. That way you guys can get a better understanding of what I'm actually doing and why I'm doing it. Honestly, it's something that
I'm fucking stupid Margaret.
um oh
Said it won't let me change my name.
hmm I wonder why. Because I know why. Because you tried it 3 attempts, so now you gotta wait. I think it's 3 months. Anyways, um, so basically, we're gonna be going over some questions. It's a practice. Blah, blah, blah. It's a practice exam. I've already took this like 5 times already, and I got the question 23,
I'm
and
fucking stupid
it just
Margaret.
messed up.
Said 3 months.
Yeah, it um on question 23, the blah, the fucking speech to text was fucking up and it made me hit the wrong answer. So I had to reset my progress. So now we have to go back and do it all. So with that being said, um sit back, relax, don't no one type anything crazy in chat, because I'm gonna be reading these. Well, I'm actually gonna have the AI actually read it, because it's just a lot to read.
What is a CNA?
So
CNA
no,
certification.
no, 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 no. Anyways, let's get on with the
I'm
show.
fucking stupid Margaret.
Um,
Said I am typing crazy stuff.
please
I'm
don't
fucking stupid Margaret. Said craz stuff.
don't do that, because then I'll have to mute the voice chat for uh chat. So be respectful, because I won't be able to hear this. So please be respectful. Anyways, let's get on with question one. Question one, I already kind of know the answer.
Question 1 of 30. The nursing assistant knows that the responsibilities of the position do not include helping a resident to bathe, administering a medication,
Mm,
keeping a resident's room tidy,
mm.
applying an ice pack as ordered.
Okay, so the reason why, okay, so the difference between, okay, so, mm, administ giving out medication. So, for an example, CNAs are not allowed to give out medication because we are not certified and we do not have the license to give out drugs or medications or antibiotics, which is a drug, a sort of medication. We're not allowed to give any type of prescriptions, RX, or anything beyond that because it's beyond our practition of learning, if that makes sense. Only LPNs or RNs or any other higher licensed professionals or personnel can produce and distribute medication. But CNAs are not allowed to because we do not have the proper knowledge or education. So that's why this would be the correct answer. Make sure it is, and it is the correct answer.
Correct. Nursing
I'm
assistants may
fucking
not
stupid
administer
Margaret.
medications. It is not
Said I
within
take
their scope of
ibuprofen and
practice.
this medicine my
Only
doc gave me
RNs,
for my
LPNs,
tonsils,
and other
smiley
properly
face.
licensed
I'm
personnel
fucking
may
stupid
give
Margaret. Said WND Tylenol.
Yeah, you're allowed to. Any doctors or anything that is allowed to give you medication, you can. But someone like me that's a CNA, that is going to be a CNA, which CNA stands for Certified Nurses Assistant. So, so for an example, when you go to your doctor's office, there's a lady that comes in that takes your blood pressure and just ask you a bunch of questions of how you doing? Do you smoke? Do you drink? Do you do this? Do you do that? Are you sexually active? Are you doing this? Are
I'm
you doing
fucking
that? Blah
stupid
blah blah.
Margaret.
That's a CNA.
Said it so my neck won't hurt.
Yeah. The CNA is the person that comes in, get your vitals, which is your blood pressure, and make sure, you're all good and stuff like that. For females and males both. Um then your doctor is the one that comes in, checks you out, depending male, female, of this certain whatever the doctor is checking you out for. So, but for a male and female, the doctor comes in, you know, talks to you for a minute. If you tell him, hey, my throat hurts, he'll assess the situation. But a doctor is allowed to give out medication because a doctor has a license, not CNA. That is that. I'm gonna actually speed through these questions.
I'm fucking stupid Margaret. Said it asked if I was sexually active and I was like, oh my lord, no, I am innocent. How dare you?
Well, no. So when a doctor asks you that, so they're basically wanting to know. So for an example, no, yes, you would say no, I'm not sexually active because they're wanting to know if you've been sexually active in the last 30 days or in the past like couple days or week or whatever. Usually 7 to 30 days. They would because the only okay, oh boy. Um the only disease that to my knowledge that you will never know if you have until 5 to 10 years after intercourse, which is sexually having sexual intercourse with someone, is syphilis, which is just which
I'm
is a
fucking stupid
disease.
Margaret.
Um,
Said herpes.
herpes. No, you can. I believe herpes is a month. No, Echo. When can you tell after sexual intercourse that you have herpes? Echo. How long can you tell until you know that you have herpes? Okay. I forget what it is. Give me a second. Let me look. I think I Hang on.
Playtime Foxy said I passed a new rule for this channel. Only users over 18 years can join the stream because due to lot of spamming, so you gotta leave sunshine.
No,
Im
that's
fucking
not
stupid
true.
Margaret. Said Reese's Puffs Reese's Puffs eat em up eat em up.
After having intercourse with an individual, when can you tell if you have herpes? I believe it's symptoms can appear after 2 to 12 days. Okay, yeah. So 2 to 12 days is herpes. The only disease that I know, like at the top of my head, that is up to 5 to
Playtime
10
Foxy
years is
said BC
syphilis.
Donnie won't take action.
No, no, shut up, Sonny. So, yeah. So, AIDS, you'll know right away. Herpes, you'll know right away. Couple days. Um, no matter what, that's why every time you do something with someone, always make sure protection is worn, because if not, then wearing no protection, you are at a higher risk of
Im fucking stupid
diseases
Margaret.
and just
Said
bodily,
Foxy, the hell you talking about?
just body fluids and diseases. But with protection, you're at a lower rate of getting diseases and, body or body fluids that can harm you. But still, protection will not protect you from AIDS or syphilis or herpes, unfortunately. For some odd reason, I do not know why, but it just doesn't for some odd reason. Um, unless if I'm wrong, but I could be wrong. But last time I checked, that protection doesn't protect you from if the other person has the disease, because no matter what, you're still gonna, yeah. So, but anytime, no matter what, anytime you have something with someone, always go get checked by your doctor. Tell them, hey, I just had this with this person, and I just want to make sure that we're good. Or before you even, if you're thinking about settling down for like a family, you and your partner go to a doctor and both get checked out, a deep checkout, and then what that will do is they will swab you, and the male and female, they will swab you and do a deep dive of that swab and send your DNA, both of your stuff, to the lab. The lab will check it out, and then it will come back saying, okay, you're clean, but you have gonorrhea. But it can be, or vice versa, or you both will be clean. But if there's a disease that one of you have that is treatable, then you get it treated, then go back, test again, and if you both were negative for everything, then you can do what you're doing. Obviously, do not take a medical advice from me, because I am not a licensed doctor or knowledge of medical. I just know a little bit of medical because I am doing medical. So if you really want actual, correct, positive results, go to Google. Okay. So I'm gonna speed through this. You guys really want to listen to it, you can. If not, perfectly fine. But I'm going to take my test. Try not to spam chat, please. It's
Playtime
just it's
Foxy
just a little
said
distracting.
ordered by President Trump to pass rules even if you are not admin or the owner of the channel.
I don't give a fuck. Like I said, I'm taking a test. Um. Anyways, sit tight. You got, just don't spam chat. Just listen, pay attention. You might learn something. Which of the following would be considered an example of battery towards a patient? All right. I want to know your guys's. answer. Let's see, because I know the answer to this, but I want to know what you guys. So, after reading the question, what do you think would be an
In
example
fucking
of
stupid
battery of a
Margaret.
patient?
Said I'm drinking root beer.
Okay, that's fine. Do you guys think A, B, C, or D?
I'm fucking stupid Margaret. Said what's battery?
Battery on a patient is like, so doing something to a patient with or without their permission, or harming a patient. So for an example, okay, I'm gonna give the answer away. So the correct answer is this one.
I'm
The
fucking
nursing
stupid Margaret.
assistant bathes the
Said
resident.
drugs. Playtime
The
Foxy.
nursing assistant bathes the
Said no
resident
drinking and driving sunshine.
without his or her permission. So basically, the reason why this is the correct answer is because, think about it this way. You have a CNA, which is someone like me. A CNA goes into a room. They ask the resident, which is the patient, the person in the bed, the senior citizen, they ask the patient, it's time for a bath or a shower. Only showers. We don't give baths. The resident refuses. Well, the nurse's aide decides to go with the shower anyways. Now, the reason how battery goes
I'm
into
fucking
effect,
stupid Margaret. Said I'm 11. I might be bad, but I would do that.
anyways, the reason why how battery would get involved is the patient is being forced, keyword forced, to do something that they're not wanting to do. That resolves into
I'm
body
fucking stupid
harm
Margaret.
or
Said wouldn't
bruises,
asterisk.
marks, harming the patient,
Playtime Foxy.
and other stuff.
Said do it.
So that's why. So battery would be, so for battery, it would be this one.
The nursing assistant bathes the resident without his or her
I'm
permission.
fucking stupid Margaret. Said no.
And that is the correct answer, and this is why it's the correct answer.
Correct. Bathing a resident without his or her permission is an example of battery. Keeping a resident isolated from others as a form of punishment is an example of involuntary seclusion.
Now, the first time I took this, I actually answered this one because I thought keeping a patient hostage is a temp of battery, but I guess not. Um, so, yeah. The difference between battery assault and battery assault and battery with senior, they're both technically kind of the same, but forcing a patient to do something is a sign of battery because it results into forcing that patient to do something, meaning forcing that patient to get out of bed by grabbing them, harming them, hurting them. Body harm and body marks and harm to a patient is a temp
I'm
of
fucking
assault
stupid
and
Margaret.
battery.
Said I love you Donnie.
So, thank you. So, let's read the next question.
Question 3 of 30.
Oops.
The nursing assistant suspects that a resident in the facility is being abused due to multiple unexplained bruises, refusal to answer most questions, and refusal of ADLs. Which of the following actions should the nursing assistant take next? Notify the nurse assigned to care for the patient about the bruises. Report the suspected situation to the nursing assistant's immediate supervisor. Ask the resident repeatedly to identify an abuser. Wait for more proof in order to identify the abuser.
So, out of these questions, now listen to the question one more time, just for a brief analysis.
The nursing assistant suspects that a resident in the facility is being abused due to multiple unexplained bruises, refusal to answer most questions, and refusal of ADLs. Which of the following actions?
So basically, that's really hard to take in. So basically, what it's trying to say, who who do you go to if you suspect that a patient is being harmed and abused and neglected? Would you go to your supervisor, which your supervisor is your nurse, or do you go to the head nurse of the supervisor for the nurse, which is the head of nursing,
Im
whatever.
fucking stupid Margaret. Said second.
This one?
Playtime Foxy.
Okay.
Said the police.
He suspected situation to the
Im
nursing
fucking
assistants.
stupid Margaret.
Wait for more
Said no
proof.
Foxy.
Let's see if you're correct. You are correct. That is correct.
Correct. Abuse in nursing facilities, or even suspicion of abuse, should be reported immediately to the nursing assistant supervisor. This requires
Im fucking
more
stupid
intervention than
Margaret.
the nursing assistant's
Said
scope of
Yayas.
practice covers. Waiting or notifying the nurse.
So basically, the reason why that's correct is if you go and tell your nurse. So in this situation, your nurse is at fault here. Your nurse is the one that did the harming and the abusive. But you don't know that. You go to your nurse and tell them, hey, I think that person is blah, 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 blah. The nurse is like, oh, okay, I'll take care of it. And they never do. Because they know, because let's say if they were at fault, they're not going to take care of it right away because they don't want to get in trouble. Not saying your nurse actually did that. I'm just setting an example. Let's say if your nurse did do that and you, being the CNA, did not know about it, then you would tell the nursing supervisor, your supervisor's supervisor, which is the head of nursing, so which is this one, pretty much.
Report the suspected situation to the nursing assistant's immediate supervisor.
The nursing assistant, pretty much supervisor. You don't tell your nurse, you go to the supervisor in charge of the whole entire building at the time. That makes sense.
Question 4 of 30. MRSA is an example of which of the following? A resistant strain of bacteria that is difficult to treat with antibiotics. A bacterial strain that is easy to treat with antibiotics. A mnemonic to remember how to act if there is a fire in the facility. A set of activity guidelines designed to keep residents safe. 1.
So out of these ones, what one do you think was the correct answer? I'm just scrolling down so no one puts it into chat GBT to get the correct answer.
MRSA is an example of which of the following? A resistant strain of bacteria that is
Playtime
difficult to
Foxy.
treat with antibiotics.
Said the military.
A bacterial strain that is easy to treat with antibiotics. A mnemonic to remember how to act if there is a fire in the facility. A set of activity guidelines designed to keep
Im
residents
fucking
safe.
stupid Margaret.
1, 2,
Said I'm not answering
3,
no more BC, I'm
4.
lazy.
Okay. So with this one, it's the first one.
A resistant strain of bacteria that is difficult to treat.
So with RS,
View PDF. Open and
with MR,
CNA practice test 1.
stop.
This
Fuck off. With MRSA, it's a type of disease that is hard to fight off with medications and vaccines. But I'm just gonna go straight through these. If you guys want me to teach you something, let me know. But I'm going to beat through these because I know the answers. What is the best way for
Im
a
fucking
nursing
stupid
assistant
Margaret.
to provide
Said answer your own
infections?
questions, it's your
Blah,
test.
blah, blah, blah,
Im
blah.
fucking stupid Margaret.
Hand washing.
N2
Said
hand
not
washing.
being rude.
Yeah, no, I know. I just wanted, I was just curious if you guys wanted to, answer them with. I know the answers. I just wanted to know. Best way
Playtime
of.
Foxy.
Uh,
Said so rude.
no, it wasn't rude at all. That was not rude at all. I don't understand why you said that was rude.
Im
Funny.
fucking stupid Margaret. Said shut up Foxy.
For real though. So in this situation, it's hand washing because hand washing gets rid of
Playtime
more
Foxy.
diseases.
Said it's true.
It is not true. That was not rude at all. Question 6 out of 30. Which of the following is a key part of care
Im
when
fucking stupid
administrating
Margaret.
a
Said
bath
true my ass.
to a clean the perineal care of a patient?
Clean the perineal area of a patient before
Okay.
assisting them to clean their
Perineal. Oh, I've been saying that wrong. Ooh,
view PDF.
that's not right,
Open
by the way. Da.
CNA practice test 1.
Stop, fucker! I'm gonna fuck you up. You better stay paused, bitch. Allow patients to care. Allow patients to care to promote.
Care to
Which is
promote a
correct.
sense of independence.
I'm gonna fuck you up. You better stay paused, bitch. Fuck you up. Stay paused, bitch. A nursing assistant care for a resident which the following skills care to correct. The nursing assistant does not begin. No, that is not correct. Assistant. Nursing assistant turns power beneath the assistant. Yeah. Wait, let me listen to
The nursing assistant applies talcum powder beneath the
which is never
abdominal folds
no.
of the resident. The, the nursing assistant notes an unblanchable red area on
Yeah.
the resident's.
Playtime Foxy. Said more rude.
Shut up, Foxy. Anytime you notice any red marks, blouches, bout, I can't pronounce that correctly. Any red marks, openings, cuts, wounds, bouches, or any type of injury or body fluid coming out of the patient, you report that to your nurse right away. Before shaving a resident, shaving instructions
Shaving
is
instructions related to problems or
bitch. Shut up. Buckle. Fecal infection. That mm, 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 mm.
Fucking stupid Margaret. Said did you know I used, probably still do, have a crush on Veneer from Trolls 3.
So okay. Said feedback. Why this ad? Go away. Go away, please. Go away. Get the fuck out of here. Go away. Body.
Playtime Foxy. Said gross you know what I'm leaving.
Anyways, I can never pronounce that word correctly.
Fucking stupid Margaret. Said good.
CNA practice test 1. This is the dyspnea is a term that refers
Dyspnea.
urinating, breathing.
Okay, I almost had I think my first time I got this one wrong too. Um, it's actually breathing.
Defecating,
Def-
swallowing,
defecating.
a raptive partner site.
Wet. Fucker. Stay paused. Fuck off.
Fucking stupid Margaret. Said I don't know why Foxy got so attitude SND mean.
Nah, he always has an attitude sometimes. Which of the following statements is true about
Which of the following statements is true about Alzheimer's residents?
Alzheimer's. For Alzheimer's,
Which of the following statements is true about Alzheimer's residents?
I'm gonna fuck you up. You keep on pausing, bitch. Stay on. Stay paused. The resident becomes to maintain routine. So basically, with Alzheimer's,
Emulation. 1, 2. It is important to maintain a routine to avoid confusion and overstimulation.
which is true. So anyone that has Alzheimer's disease, it's good to stick to a strict routine because they're used to that routine. The difference between Alzheimer's and dementia, people get Alzheimer's and dementia mixed up, which is it's common, but dementia, you can't really remember things. So also with someone with Alzheimer's and dementia, this answer would be benefit for both because someone with dementia, well, actually no, dementia it's a little harder for them because they can't remember, but someone with Alzheimer's, they're they're on that you know they're on that last stretch. So someone with Alzheimer's, it's good to keep them on a strict routine schedule. That way, it's easier for them and they don't get, like they said, used, okay, overstimulated, which is true.
Correct. Maintaining a routine is incredibly important to Alzheimer's patients. Hallucinations and a decrease in appetite are common. It is important to frequently reorient the patient. Which of the following is a correct aspect of making an occupied bed? Place soiled linen on the floor until the bed has been remade with clean sheets. Lower the bed to the lowest level when the procedure is complete. Avoid raising the bed rails unless absolutely necessary. Mitering the corners of the new sheet is no longer recommended. Correct.
So, an example. So, with younger people like myself, still a 45 pulse rate would be still pretty low, but it could be common, but not really. So, with seniors, yes, 45 is risky. So, that's that.
Lowering the bed to the lowest level is important for safety. Mitering the corners of sheets is recommended, as is raising side rails. Question 14 of 30. The nursing assistant knows that signs of hypoglycemia include which of the following? Tachycardia, polyuria, hot and dry skin, sweating. Sweating. 1, 2,
Im
3.
fucking stupid Margaret. Said, can I break the silence?
Sure. I'm just reading. You could talk. I'll answer any questions, um but I'm just reading. Which of the following guidelines uh, art of hearing would be considered speak clearly and slowly?
Speak clearly
Okay.
and slowly as you face the resident.
Or,
Correct. Speaking slowly and clearly is the key to helping hard of hearing clients. Question 16 of 30. A resident is ordered to be in high Fowler position for each meal. Which of the following?
high power position is a 90-degree position, meaning you're sitting up straight, like up straight, sitting straight with your legs that way. See, we're flying these questions. And I still got more to take. I gotta take one. Well, I gotta take two, three, four. And then study guide, CNA. Oh,
Im fucking stupid Margaret. Said Donnie, you have 3 ppl watching.
nice. Thank you. Thank you for that information. Appreciate it. Appreciate it. Yeah.
Following descriptions is the patient lies on their the patient's bed, the patient's correct. Hi Fowlers, question 17 of 30. What protective equipment should be worn when changing an incontinent patient? And gown. Gloves, gown, and a mask.
Fuck.
28, 29,
Oh,
30. Current.
right. See, you all saw that? It tried doing it again. Come on. You piece of shit. Alright.
Im fucking stupid
The nursing
Margaret.
assistant takes the
Said
temperature of
Reese's Puffs eat em up, eat em up.
what? And finds it to be 106 degrees Fahrenheit. The client reports having just taken a. Oh, it's different now. Fuck me. Alright, give me 1 second, y'all.
Im fucking stupid Margaret.
Current. Correct.
Said 2
Incorrect.
questions left.
Looking for more practice? Get hundreds of CNA practice questions. What is a CNA? CNA finds privacy policy. About us.
Okay, give me one.
Question 28 of 30. The nursing assistant takes the temperature of an elderly client and finds it to be 100.6 to 8, 19, 20. Question 18 of 30. Of the following symptoms, which one is most likely due to an infection in a resident? Pale skin. Den onset confusion. Aphasia. Correct. 1. Question 19 of 30. The nursing assistant knows that the term NPO means bed rest only. Hing by mouth. Liquid diet. 1, 2. 1,
Can you
2.
stop, motherfucker?
Nothing by mouth. First Light Home Care. First Light Home. This is the
I'm gonna
first of our
fuck you
free
up, bro. Stop. Fuck. Motherfucker.
Question 20 of 30. The nursing assistant should tell the nurse if the client with diabetes does not touch their lunch tray.
Right.
Does not touch their lunch tray. Reports numbness in their feet sometimes.
Wrong.
Combs their hair without being prompted. Decides not to finalize a will. Correct. Question 21 of 30. The nursing assistant knows that residents on bed rest must be turned every 2 hours, 1 hour, 6 hours, 8 hours. Correct. Residents on bed rest. Question 22 of 30. What is a CNA? CNA certification.
Oh my
Find
god. I'm
CNA
gonna fuck
classes.
you up.
Privacy policy.
Fuck you up.
CNA practice test 1. Question 22 of 30. Which of the following
Im
pulses will
fucking
be
stupid
most commonly
Margaret.
used by a nursing
Said I
assistant
like
when
dogs.
acquiring vital
Smiley
signs?
face.
Popliteal, radial, brachial, brachial, femoral. 1. Radial, brachial, femoral. Correct. The radial pulse is the most. Question 23 of 30. The nursing assistant is helping residents to eat in the dining room when, suddenly, a resident stands from their seat and begins clutching their throat while coughing silently. The nursing assistant performs which of the following actions first? Ask the resident if they are choking. Call 911. If they are choking.
So this one I actually got wrong. I actually picked this one. Well, for number one, for uh, first, you're supposed to ask them, "Are you choking? Do you need help?" And if they do not respond to you, then you begin the abdominal thrust or the Heimlich maneuver.
Correct. It is important to first assess whether or not the resident is choking. If they are able to answer, Air is still moving through the trachea. If they nod yes, but are unable to speak, it is time to begin the Heimlich maneuver. The Heimlich should not be performed on anyone who is able to cough or speak. 1, 2, 1, 2, 3, 4, 5, 4. Question 24 of 30. A client at the facility receives a new roommate. While the roommate is in the bathroom, the client leans toward the nurse and whispers, "Why is she here anyway? Is she sick?" The best response by the nursing assistant is, "I'm not sure. Let me take a look at her chart." Why don't you ask her yourself? She's here for the same thing as you. I'm afraid I can't share that information with you.
The reason why? Because it goes against the HIPAA. It's a HIPAA violation. Any patient or anyone that is admitted into a hospital or a facility, in a medical facility, their medical privacy is private, which is locked. So any medical personnel, CNA, doctor, nurse, LPN, whatever, cannot discuss anything. Even for an example, let's say you're in the hospital and you're in the hospital in bed in the hospital and you're sick. Your uncle,
Im fucking stupid
your uncle
Margaret.
comes in.
Said you have your highest viewers. 4 people.
So for an example, a patient is in the hospital bed. Let's say for an example, I'm in the hospital bed and one of you come into my hospital room. You're one of my friends. For privacy reasons, the nurse cannot give you an example or the reason why I am laying in bed because it is a HIPAA violation. Now, if you were my mother or father or sister or brother, that would be different. I would still have to give consent though. So technically, let's say if you're laying in bed and you're over 18 years old, the nurse or doctor is not allowed to tell anyone, even your mom and dad, why you're in the hospital because it's a HIPAA violation. Since you are over 18, they would need your consent, even if it's your mom and dad. I could be wrong, but that's what we got taught. Now, if you're under 18, the only people that are allowed to know about your medical information is your parents or guardians. So, mom, dad, grandma, grandpa, or brother or sister. Anyone that is taking care of you, that is your guardian, is the only ones that are able to know your information. And the nurse assistant is allowed to ask for additional information to make sure that you are the correct person to the patient. So, for an example, a CNA will not be able to ask you for an ID that I know of. They would have to go get a nurse, and the nurse is legally allowed to ask you for your identification or driver's license to make sure you belong. Oh, so you are the father of this patient. Okay, makes sense. Makes sense? Okay. Hopefully it does. If not, then I don't know. I'm so lost. What?
I'm afraid I can't share that information with you.
Right.
Correct. HIPAA requires you to keep clients' health information confidential. Period.
Yeah. Unless if you're over, as long anyone that's over 18, no one can know. Beside no one. They need your permission. Anyone that's under 18, the only people that are allowed to know the patient's information is the parents or parent guardian. So the guardian of the patient or the parents in general. Depending on what state you live in. It could be I could be right, could be wrong. Because it could in Michigan it is like that, but in Ohio it could be different. For an example.
Question 25 of 30. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that, after breakfast, it is most important to support normal gastrointestinal tract function by recording intake and output, brushing the client's teeth, taking the client to the
Playtime
bathroom,
Foxy.
assisting the client to
Said
call
wrong when
family
I was
members.
underage, my doctor wouldn't tell my parents' mom that I was blank.
Bye. Yeah, some, like I said, some states require different protocols.
Assisting the client to call family members.
Okay, let me read this one more.
USGen 25 of 30. A client with Alzheimer's wakes up more confused than usual one morning. The
Okay.
nursing assistant knows that, after breakfast, it is most important to support normal gastrointestinal tract function by recording intake and output, brushing
Yeah, they just got done with breakfast, so you got to record,
ache and output,
right? Yeah, you're supposed to record everything, no matter what.
recording intake and output, brushing the client's teeth, taking the client to the bathroom, assisting the client to call family.
Okay, so this is wrong. This ain't correct. This ain't the right answer. This happens before they go eat breakfast. So it's either one or two. And this is after breakfast. So I'm going to pick that one. Wow, really? Really?
Incorrect. Taking the client to the bathroom will most likely prompt a bowel movement, which supports GI tract health. A
Oh.
confused patient may not remember what the urge means. 1.
Oh, yeah. Okay. That question went over my head. They just got done eating breakfast, so they're not gonna know if they gotta go to the bathroom. So that is correct. Wow, taking input and output. What? Okay, why did I pick that? I would have did that already. It would have been that one. Fuck. Uh, fuck. Fuck. Speedrun. Yeah, Palladians. I know. I know. I'm not supposed to
Im
retake, but
fucking stupid
yeah,
Margaret. Said gotta retake the test.
I know. I don't. I want a full clean. I want all of my answers to be correct. This is actually helping me. It's not that I'm not wanting to fail, because there's a few of them that I did not know. So every time I get one wrong, I retake the whole thing for punishment, and I've been doing good. So I'm not even reading the question. I'm just going off of the answer now. It was uh, the nursing assistant leaves a resident without his or her permission. The nursing assistant aspects, which is this one. MRSA, which is that one. Right. What is the best way for a nursing hand washing? Which of the following is a key part of care and back to a resident? Blah, blah, blah. Allow participation in care of a patient. Always let the patient see if they can wash themselves. A nursing assistant cares for a resident which has The nursing assistant cares for a resident which of the following skin. Da, 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 da. The nursing assistant applies a body cream. The nursing assistant applies a. The nursing assistant notices a.
Im fucking stupid Margaret. Said I betio aliki Andy. Im fucking stupid Margaret. Said I am fucking stupid Margaret.
Before shaving a resident, blah blah blah. You always check the care plan. Da, da, da. And yes, if everyone wants to know, yes, we it is required for us to help patients shave where they need to be shaved at. That's wherever on their body. So yes, a CNA does have to shave hair from down there if needed. So, anyone want to? Unless if a nurse does it, but sometimes it depends. It depends, but sometimes a nurse does it well because they could have like a medical condition where there's a certain if they have like diabetes or something else, then it's always good to check the care plan before shaving a resident. Check their shaving plan, like how to shave this person, because some people can't be touched on because they're sensitive because their skin's fragile. So for us, our skin is tough, so we're allowed to shave our face and down where we have to shave.
Im fucking stupid
But for
Margaret.
someone that's
Said VGH and VHG and VGH MVGH MVGJH CGHGHK VHJH VGGHJHGJ VGHK VHG and VGH and VGH and VGH and VGH and
why
VGH and VGH and VGH and VGH and VHG and VHHK VG.
why bad. Don't do that. That's the correct answer. Bella's position is a 90-degree. Wait. Phil is a small. Thespia
Im
is
fucking stupid
ring.
Margaret. Said okay, he'll stop.
Thank you. Just no long spamming messages. Just which of the following statements is true about Alzheimer's? Resident becomes. It is important to administrate routine to avoid. Which of the following is a correct making place soiled? No. Lower the bed. Yes. Always lower the bed to the lowest position after making the bed. Make sure all sheets, all bedding, all sheets are tight, tight, tight. There cannot be no wrinkles in a bed for a older patient because that can cause pressure ulcers and skin tears. That Which of the following is an example of a pulse rate? 45, 55. Not any between 60 and the 60s range is good. Anything over 100 is not good. Depends. Yeah, anything 60, 60, 70 is okay. 45 is a little scary. It's a little low. And anything over 100 is a little too fast. It'd be normal if it was us, but for someone that's that old and knowing that they don't work out or do exercising, then yeah. Hot and sweaty. It is sweating. Speak clearly and slowly. Correct. I should be reading the answers. A resident is ordered to be a high flowers position, which is a 90-degree position for eating. Unless if the patient has a feeding tube, then they will be laid back about like this. So about like a 160.
Im fucking stupid Margaret. Said, is it okay for people who are healing from tonsil surgery to steal 2 packs of ice cream from the fridge? Playtime Foxy.
Yeah, that's fine.
Said it would be your fault if Donnie fails the test because of spam.
No, she is fine. Stop. No, it's fine. That's that right here. I'm gonna tell you right now, this right here is not safe. It looks like they're about to go into surgery or they just got out of surgery. So let's say if they're going into surgery, you never want to touch each other or touch anything because, it just, I'm gonna take a little second. My phone keeps blowing up. Hmm.
Im fucking stupid Margaret. Said Foxy, it's gonna be your fault as I have no sanity left. Im fucking stupid Margaret. Said, I'm eating ice cream.
Nice. Yeah.
Playtime Foxy. Said, can I have some?
Jesus.
Im fucking stupid Margaret. Said, no, you mean it. Im fucking stupid Margaret. Said, you have consequences.
Mm-hmm. Sorry, I'm doing something right now, guys. Shut up. Actually, no, I don't. Mm-hmm.
Im fucking stupid Margaret. Said, me waiting for the laughter, side eye. Playtime
Mm-hmm.
Foxy. Said gimme now. Im fucking stupid Margaret. Said I won't give you ice cream. You have consequences to pay. Im fucking stupid Margaret. Said, can I break the silence?
Yeah, sorry.
Playtime Foxy. Said, I give you pizza if you gimme ice cream.
You can't have pizza.
Playtime Foxy. Said, nobody asked you, Donnie.
Well, technically, obviously, you're not educated, so I gotta educate you. Anyone that gets their tonsils removed cannot have any hard or heavy food. They have to have pretty much liquid. So that's soup, yogurt, jello, smoothies, a shake, ice cream, anything soft. They can't have anything hard. So, uh, next time before you open your mouth, maybe you should do some research and check. Bam, got him.
Im fucking stupid Margaret. Said, cool. Im fucking stupid Margaret. Said I timed out Foxy for 1 minute for being mean. Im fucking stupid Margaret. Said I think Fixie is out from timeout.
Sorry, I was messing with someone up. One sec. Give me 1 second. Hang on. Okay. Whatever else I guess. Okay. I'm sorry. I just had to respond. I just had to look at something and respond to someone. Okay. What are we doing? Yeah. All right. Moving on.
What is a CNA? CNA certification. Question 17 of 30. What protective equipment should be worn when changing an incontinent patient? Oves and gown. Mask and gown. N95 mask. Gloves, gown, and a mask. Correct. Question 18 of 30. Of the following symptoms, which one is most likely due to an infection in a resident? Pale skin. Tentative.
Im fucking stupid
Den onset
Margaret.
confusion.
Said I'm so
Aphasia.
silly.
1, 2, 3, 4, 5. Question 19 of 30. The nursing assistant knows that the term NPO means bed rest only. No oral temperatures are G by mouth. Liquid diet. 1, 2, 3, 4, 5. Question 20 of 30. The nursing assistant should tell the nurse if the client with diabetes does not touch their lunch. OT touch their lunch tray. Reports numbness in their feet.
What does anyone remember what question we left off on before I had to reset? Was it 28? I think it was 26, right?
Question 21 of
Playtime
30.
Foxy. Said I be nice now.
Estion 21 of 30. The
Im
nursing
frucking stupid
assistant knows that
Margarette. Said I don't know.
That's
that
alright.
residents on bed rest must be turned every 2 hours. RS 1 hour. 1, 2. Question 22 of 30. Which of the following pulses will be most commonly used by a nursing assistant when acquiring Question 23 of 30. The nursing assistant is helping residents to eat in the dining room when, suddenly, a resident stands from their seat and begins the resident if they're 1, 2. Question 24 of 30. A client at the facility receives a new roommate. While the roommate is in the bathroom.
Oh, it was this question, actually.
Question 25 of 30. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that, after breakfast, it is most important to support normal gastrointestinal tract function by
Oh, that's right.
download PDF.
It says
CNA
it.
practice
No,
test
fuck.
1.
No.
This is the
Quiet. Damn it. It says it right there. Promote bowel contraction thing. Taking the client to the bathroom.
Im frucking stupid Margarette. Said to he.
I'm the fucking stupid one right here. Really?
first.
Im frucking stupid Margarette. Said I like kids.
Alright. Well, that's not. Hello?
CNA practice test 1. Question 26 of
There we
30. The client asks the nursing assistant to assist her to cut her toenails. The nursing assistant knows this client has type 2 diabetes.
go. No.
Which of the following actions is best? Retrieve a safety clipper and hand it to the client.
No.
Report to the nurse that the client needs her toenails trimmed. Check the
Exactly.
client's
With someone, this is a question. If if anyone, if an older patient has diabetes in general, you are not to clip their toenails or fingernails. You are not allowed to do so. Lead, it could lead to really, really a risk to the patient. So always ask a nurse or a doctor, take them to a doctor so they can get assessed and treated for that. What? No, that's wrong. No, that's wrong. That's wrong. No. Yeah, no. That's wrong. No.
check the chart for physician orders regarding nail trimming.
No.
Incorrect. Diabetic clients often have special instructions regarding nail trimming. Check the chart for specific orders.
That's fucking bullshit. I was. You're fucking on. You're fucking high. So apparently, my professor was wrong then. I was taught anyone with diabetes cannot get their toenails clipped. Really? That's fucking bullshit. Do I have to restart this all over again? Ah!
Fucking stupid Margaret. Said IMA report this to government.
Check the client. No, it's fine. Check the. Fuck! Alright, time to restart. God damn it. We're so close! What is the last two questions?
What is a CNA? CNA certification. Find CNA. Question 29 of 30. A client under the nursing assistant's care suffers from chronic. Ad ends in 4. Question 29 of.
Motherfucker.
Question 29 of 30. A client under the nursing assistant's care
Playtime
suffers
Foxy.
from chronic foot
Said I'm telling you Donnie, the USA government is corrupt.
drop. The nursing assistant can expect to find which of the following devices in the client's room? A wedge. A wedge. A wedge.
Fucking stupid Margaret.
Why
Said
isn't this
agreed.
working?
Study guides.
Fuck
CNA
this
class.
damn thing up. Why aren't you working?
Question 29 of
Thank you.
30. A client under the nursing assistant's care suffers from chronic foot drop. The nursing assistant can expect to find which of the following devices in the client's room? A wedge. A mechanical lift. Positioning boots.
Fucking stupid
2 extra
Margaret.
pillows.
Said a wedge equals a wedge. Fucking stupid Margaret. Said ha 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 ha.
Fuck is a foot drop? A what? A foot drop? A, a fucking foot job. I'm gonna say mechanical lift?
Nickel lift. Positioning boots. 2 extra.
Positioning. Oh! What? Ah, fuck you. Yeah, I would have got that wrong. Wrong. Ah. What about 30? Jesus fucking criminy. Come on,
What
bitch.
is a CNA? Question 30 of 30. A nursing assistant takes the blood pressure of a client. Ad ends in 15.
I'm gonna fuck you up if you keep doing that stupid shit. Come on.
Question 30 of 30. A nursing assistant takes the blood pressure of a client and finds it to be 82/43. The client reports feeling dizzy. The nursing assistant should take the client's pulse next. Report the finding to the nurse. Record the vital sign in the chart. Instruct the client to drink more fluids. 1.
No, you report that bitch to the nurse. Correct. Yeah.
29. 30.
Pressure
Ironing
fruit?
boots. 2 extra.
I guess so.
29. 30. Current.
I'm gonna fuck you up. Shut up.
Question 28 of 30. The nursing assistant takes the temperature of an elderly client and finds it to be 100.6 degrees Fahrenheit. The client
Whoa!
reports having just taken a sip of hot tea. Which of the following actions is appropriate? The nursing assistant waits at least 15 minutes before retaking the temperature. The nursing assistant records the temperature in the chart.
No.
The nursing assistant scolds the client for not letting her know beforehand.
No.
The nursing assistant takes an axillary temperature instead. 1.
No. You just wait 15 minutes.
Temperature. The nursing assistant records.
Just wait 15 minutes. Yeah. You don't take an axillary fucking No, you don't take an armpit fucking reading. No, fucking wait 15 minutes. But while you're waiting 15 minutes, ask them to not, you know, if they can ask them to finish their tea and then wait 15 minutes. And while they're doing that, have them drink, I think cold, like just, I don't know, any, like a cool, like warm, like cool water, and then don't drink nothing at all for like
28, 29, 30. Question 27 of 30. Which of the following options is the best method to prevent insomnia? Ensure the client eats 1 apple per day. Encourage the client to take several naps daily. Encourage the client to take several walks around the facility daily. Encourage the client to remain in bed throughout the day.
no
1, 2.
insomnia. Definitely not that. Courage. Actually, not too sure.
T, to
That.
take several naps daily. Encourage the client to take several walks around the facility
Damn.
daily. Encourage.
That. Damn.
Fucking stupid Margaret. Said fuck the question. I have insomnia weary face. Fucking stupid
What is a
Margaret.
CNA?
Said eggplant. Fucking stupid Margaret. Said skull. Fucking
Add
stupid
ends in
Margaret.
2.
Said
Question.
hot face nail polish.
Something's wrong with you, girl. But it's alright. I respect. I respect it. I respect it.
Correct. Walking and physical activity during the day promotes rest and well-being at night. 1, 2, 8.
Ah.
Question 28 of 30. The nursing assistant takes the temperature of an elderly client and finds it to be 100
Wait
temperature.
15 minutes,
The
baby.
nurse
Yeah.
he nursing assistant
Fuck you up.
has an
Keep on
axillary temperature.
pausing. See what happens. Keep doing it. Catch these hands. For real. Mm, mm, mm. I was about to say. Damn. And fuck you up.
Temperature instead. Correct.
Cat.
Waiting
Shut the
15
fuck
minutes
up. Shut
ensures the
the fuck
temperature of the
up.
mouth. Question 29 of 30. A client under the nursing assistant's care suffers from chronic foot drop. The nursing assistant can expect to find which of the
Nipples on my boot.
CNA practice test
And
1.
fuck you up. Keep. Try. Mm, 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 mm,
0.
mm. 0, bitch.
Question 30 of 30. A nursing assistant takes the blood pressure of a client and finds it to be 82/43. The client reports feeling dizzy. Report the
Report that
finding to the
bitch to
nurse.
the nurse. Report that bitch to the nurse. Yeah. Yeah.
6. Question 26 of 30. The client asks the nursing assistant to assist her to cut her toenails. The nursing assistant knows this client has type 2 diabetes. Which of the
Playtime
following
foxy.
actions is best?
Said how long is this test?
Chart for physician orders regarding nail trimming. Correct.
I want to know what's correct about this.
Correct. Diabetic clients often have special instructions regarding nail trimming. Check the chart.
Okay, maybe no. Okay, my teacher was correct, but normally you're not allowed to cut a patient's toenails if they are diabetic, unless unless if it's okay by the doctor.
Fucking stupid Margaret. Said 30 questions.
Yeah, I know. I just keep retaking the test.
2.
Okay, watch me fly through these bitches. Watch this. Medicine.
Airing a medication.
Alright,
Keeping a
bitch.
resident.
Fuck you. Shut the fuck up. I know how to read. Pussy. Yeah, I'm gonna say hostage. 100 bucks. No. Team assistant.
Resident's room tidy.
Fucking stupid
Applying an
Margaret.
ice pack as ordered.
Said I like woman.
Nursing
I
assistant.
like
Question
females.
3 of 30. The nursing assistant suspects that a resident in the facility
fucking
is being
stupid
abused
Margaret.
due to multiple
Said
unexplained
now I
bruises,
actually like
refusal
girls.
to answer most questions. 8. Supervisor. Ask the resident repeatedly.
That's okay. That's respectful. That's respected. I respect that.
Persistent strain of bacteria that is.
Playtime Foxy. Said same.
Question 5 of 30. What is the best way for a nursing assistant to prevent infection? Use standard precautions when caring. Question 6 of 30. Which of the following is a key part of care when administering a bath to a resident? Clean the perineal area of a patient before assisting them to clean their face. Use cool water when bathing the patient to promote better circulation. Allow participation in care to promote. Question 7 of 30. A nursing assistant cares for a resident. Which of the following skincare measures are correct? The nursing assistant does not. A nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse. The nursing assistant applies top. The nursing is correct. It is the duty of the nursing. Question 8 of 30. Before shaving a resident, the nursing assistant checks ons related to problems or. Question 9 of 30. Fecal impaction may present with which of the following symptoms? Watery leakage of stool. Question 10 of 30. Dyspnea is a term that refers to difficulty hing, breathing, defecating.
Oh, okay. So, rebel proven.
Fucking stupid Margaret.
Question 11 of 30.
Said I like gems.
Which of the following statements is true about Alzheimer's residents? An increased appetite is common as Alzheimer's progresses. Residents can never be reoriented. Important to maintain a routine to avoid confusion and overstimulation. Correct. Maintaining a routine is. Question 12 of 30. Which of the following is a correct aspect of making an occupied bed? Place soiled linen on the floor until complete. Avoid raising the bed rails unless absolutely necessary. 1, 2, 3. Question 13 of 30. Which of CNA Practice Test 1. Question 14 of 30. The nursing assistant knows that signs of hypoglycemia include which of the following? Wedding.
It's what? Like cover over.
Question 15 of 30. Which of the following guidelines regarding residents who are hard of hearing would be considered correct? Encourage family participation. Speak clearly and slowly as you face the resident. Correct. Speak. Question 16 of 30. A resident is ordered to be in high Fowler position for each meal. 1, 2, 3, 4, 5.
Tenemos pues.
Question 17 of 30. What protective equipment should be worn when changing an incontinent?
Im fucking stupid Margaret. Said nail polish nail polish nail polish nail
CNA
polish
practice
nail
test
polish
1.
nail polish 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 nail
Den
polish nail
onset
polish
confusion.
nail polish nail polish nail
1,
polish nail polish
2.
nail polish 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 nail
Question
polish
19
nail
of
polish
30.
nail polish nail polish nail polish nail polish
The
nail
nursing
polish nail
assistant knows
polish
that the
nail
term
polish nail
NPO
polish nail
means
polish nail 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 nail polish
017.
nail polish 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 nail
CNA practice test 1. A raptive partner. Question 20 of 30. The nursing assistant should tell the nurse if the client with diabetes. CNA practice test 1. Question 21 of 30. The nursing assistant knows that residents on bed rest must be turned every hours. Question 22 of
Im
30.
fucking stupid
Which of the
Margaret.
following pulses will be
Said raise
most
your
commonly
ya.
used by a nursing assistant
Im
when
fucking
acquiring
stupid
vital
Margaret.
signs?
Said
Popliteal,
ya.
radial,
Im fucking stupid
brachial,
Margaret.
femoral.
Said ya.
1,
Im fucking stupid Margaret. Said ya.
brachial, femoral. 1, 2, 3, 4. Question 23 of 30. The nursing assistant is helping residents to eat in the dining room when, suddenly, a resident if they are choking. Question 24 of 30. A client at the facility receives a new roommate. While the roommate is in the bathroom, I'm afraid I can't. Question 25 of 30. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that, after breakfast, it is most important to support normal to the bathroom. Current. Correct.
Im fucking stupid Margaret. Said you're done.
13 minutes and 16 seconds. Ah! Damn. Damn, that's crazy. What the fuck? You have reached 30 of 30. Few questions. Main menu. Next test. Okay, did we take the next test, children? Next test. Wow, I didn't think I was timed. That's crazy. 13 minutes, 30 questions. Ah! Crazy. Next test.
What is a CNA?
I don't know what the fuck a CNA is. What is a CNA?
Question 1 of 30. Add ends in 2.
Well,
Question
fuck you up.
Question 1 of 30. The range of motion term abduction means moving the extremity away from the body,
Fucking stupid
moving the
Margaret.
extremity toward the
Said
body,
I like bitches.
moving the extremity above the body,
Playtime Foxy.
moving the extremity.
Said same. Fucking stupid Margaret. Said ya Oz.
Did I ever change my screen back? Okay.
Fucking stupid Margaret. Said you did.
Okay. I was just making sure. Who just tried calling? What?
At Antonio.
Hang on. Yo, what's up? I'm testing right now. Test? What? The CNA thing. Yeah, I'm just studying, but I'm taking a practice test right now while streaming. Hmm? I'm down to 2 that I know of. That was the last knowledge. I haven't. I'm probably down a little bit more. I don't know. I haven't made my.
Fucking stupid Margaret. Said O'Donnell's calling someone.
I am calling. So. The chat's talk. That's crazy. Crazy statement. Are you feeling much better? You sound better. Or you sound better. I mean, you sound normal, but you just sound maybe like a little stuffy, but you sound normal. Take yourself a nice hot shower. Keep some tea. Yeah, but I'll talk to you in a little bit, alright?
Him fucking stupid Margaret.
That was my brother.
Said he sounds hot.
uh,
Extremity below the body. Question 1 of 30. The range of motion term abduction means moving the extremity away from the body, moving the extremity toward the body, moving the extremity above the body,
I'm not gonna
moving the
lie.
extremity below the body.
Never below the body. I'm not gonna lie.
Moving the extremity away from
I
the
forget.
1, 2.
Wow. Yeah.
The range of motion term abduction means moving the extremity away from the body.
So abduction. We're moving things away from the body. Abduction. Got it? Got it. No, it's my brother. He's I'm not gonna lie, I thought he was gonna call me for something else.
Question 2 of 30. Which of the following most addresses a client's needs in regard to spirituality? Ask the client why he or she is of a particular faith. Provide the client with warm water, soap, and towels every morning. Assist the client to the facility's chapel every Sunday. Treat any religious objects in the client's room as if they were any other.
Exactly.
Any other. 1.
What? No way! What? No! Nah. That's what time it is. It's time to make another report. Yay! Go fuck. Fuck!
What is a CNA? Question 3 of 30. Proper body mechanics when lifting clients involve which of the following? Keep the spine curved. Bending at the waist. Bending at the knees. Avoid seeking assistance. 1.
Bend those knees! Get on them knees! Bend them knees!
G at
Yeah!
the knees.
G at the knees is crazy. Gotta bend them knees! Yeah!
Question 4 of 30. Which of the following would be a primary indication of hepatitis? Hypertension. Hyperglycemia. Jaundice. Hypotension.
Oh my god. No!
Question 4 of 30. Which of the following would be a primary indication of hepatitis? Hypertension.
Hypertension?
Hypertension.
It's one of these.
Hyperglycemia.
It's one of them.
A raptive partner site.
No! What one? I think it's the other one. Ah, I knew it! Fuck! Ah! Fuck! Damn it!
Jaundice.
I fucking knew it!
A
Fuck!
raptive partner site.
Guess what time it is? It's time to answer the questions. And then lose. And lose. It was Johnny Bravo. Ah, fuck! Don't you
What is a
wanna touch
CNA?
me? Don't you wanna?
Question 5 of 30. Which of the following aspects of care is important for a confused client? Checking the client's blood sugar every hour. Asking the client their name. Keeping the client contained in their room. Reorienting the client frequently with clocks, calendars, and family mementos.
What
1.
the fuck? What the fuck?
Question 5 of 30. Which of the following aspects of care is important for a confused client? Checking the client's blood sugar every hour. Asking the client their name. Keeping the client contained in their room. Reorienting the client frequently with clocks, calendars, and family mementos. 1.
Keeping the client contained in their room. I don't think that's it. Asking the client their name.
G. The client their name.
Uh,
A raptive partner site.
fuck! Quit! Wrong! I knew it! What? Remaining clocks! What? Yeah, hang on. What? Hang on, I gotta read this.
Incorrect. Reorienting the patient frequently is the most important aspect of care. Keeping the client locked in their room could agitate them.
That's what that means? No! Guess what time it is? It's time to restart. No! Bro, what? Get off of my screen. The fuck you. Don't you wanna touch yourself? Up, down the mountain. Fuck. Ignore me. What was this one? This one was this one, correct? It was. Good shit. Touch my nose and call me Jerry. Good. What the fuck did I just keep the no, we gotta get on our knees. Fuck. No, it's bend them knees. Bend them knees. Bend them knees. Janice.
Fucking stupid Margaret.
It,
Said call Andy and say he impregnated you and hang up.
the fuck? Why? You impregnate? What? You impregnated me. What? That's. I'm taking a test. I'll do it in a minute. I want to get through these questions. I will do it. Checking the diet nipples. Nipples. Keeping the client contained in their room. Restricting their bitch ass in their room. Yeah, that's right. Fuck you. Get your ass in your room. Stand up.
What is a CNA?
I don't know what a fucking CNA is. What the fuck is a CNA?
Question 6 of 30. What type of client may opt to receive hospice care? Client with kidney disease. Client with cancer. Terminally ill client. Client with diabetes.
Oh, what was that
CNA
question?
practice test 2.
Bitch!
This is the
Bitch!
second of our free.
Bitch! You start with me. Fuck you up. I'm gonna fuck you up. Bro, come on. Just work. No one cares.
CNA practice test 2.
Ah.
Question 6 of 30. What type of client may opt to receive hospice care? Client with kidney disease. Client with cancer.
Oh, yeah.
With cancer.
Hospice is cancer, right? What? I was right! Fuck! Damn it! Fuck! Ah! What? Which of the following most
Im fucking stupid Margaret. Said call Andy and say that he impregnated his pet.
Oh, I'm not doing that. That's weird.
A CNA. Question 7 of 30. Shane Stokes' respirations occur in a client who. Question 7 of 30. Shane Stokes' respirations occur in a client who has a history of chronic respiratory issues, is unconscious, is recovering from an asthma,
It's these
is
stupid
recovering
fuck.
from an asthma.
It's these stupid fucking questions. Stop saying the medical termination. Just say the real fucking definition, motherfucker.
Im
Fuck.
fucking stupid Margaret. Said call Andy.
Asthma attack is close to death. 1. Question 7 of 30. Shane Stokes' respirations occur in a client who has a history of chronic respiratory issues, is unconscious.
I think it's A.
Im fucking stupid Margaret. Said call Andy.
Correct answer.
Im fucking stupid Margaret. Said my grandma texted me skull.
It was A. What the fuck? What do you mean? And 40. I think I'm gonna get off. My brain's not functioning correctly right now. It knows it's getting late. Fuck. I just want to pass this one. I'm gonna restart. The range of it is. Remember that? Which of the following most address a client needs in ask the client why or oh fuck! I hit the wrong one. Fuck me. Send them news. It is jaundice. Keeping the client controlled in their room is the last. Give them a fucking clock to flip. Yeah. Can you stop playing porn in the fucking lower corner? Client with kidney disease. Client that's terminally ill. Terminal. Criminal. Has a
Im
history
fucking
of.
stupid Margaret.
I guess it's fucking
Said
death.
NGHH.
Guess it's fucking death. Why is it death? I don't fucking know. Gonna find out.
What is a CNA? CNA certification. Correct. Cheyne-Stokes respirations are a breathing pattern marked by increased respirations, labored breathing, and periods of apnea, no breathing. It is important to report these signs if discovered in a resident who is not expected to show them. 1.
That made no fucking sense. Did y'all understand that? Cause I fucking did not. What?
Correct. Cheyne-Stokes respirations are a breathing pattern marked by increased respirations, labored breathing, and periods of apnea, no breathing. It is important to report these signs if discovered.
Okay, where in the question did it say report? It just says to is close to death. So okay, I'm gonna say Shakespeare respirations is death. Got it.
Question 8 of 30. A client in the day room is having a panic attack. The nursing assistant should tell the client to breathe as slowly and deeply as possible. Have the client talk about the panic attack. Encourage the client to verbalize their feelings. Ask the client about the cause of the panic attack. Ask the client about the cause of the panic. Tell the client to breathe as slowly and deeply. Correct. During a panic attack, the nursing assistant should make the client comfortable and encourage them to breathe slowly and deeply. Asking them to count backwards slowly from 100 can also be helpful. During an attack, the client is unable to talk about anxious situations and isn't able to address uncomfortable feelings and frustrations. While having a panic attack, the client is also unable to focus on anything other than the symptoms, so the client won't be able to discuss the cause of the attack.
I hate having panic attacks, dude. They fucking suck. I only get panic attacks when I'm really like emotional and really overwhelmed. But it's like it's fucked. I can't. It's fucked.
Question 9 of 30. Which of the following residents is demonstrating orthopneic position?
What? Excuse me?
1.
Can you pronounce that one more fucking time?
Question 9 of 30. Which of the following residents is demonstrating orthopneic position? A resident sits in a chair with their back straight. A resident sits.
What the fuck is that?
Which of the following residents is demonstrating orthopneic position? A resident sits in a chair with orthopneic position. Orthopneic position? Position?
Orthopneic.
A resident sits in a chair with their back straight.
I have
A
no
resident
fucking
sits
clue.
e-table. A resident walks using
Im fucking stupid Margaret. Said he'll bark for you, just say the magic word.
Breathing that orthopneic refers to difficulty breathing that occurs when lying down and is relieved by sitting or standing up, often associated with conditions like heart failure or COPD. Here's a more detailed explanation. Definition. Orthopnea is the medical term for shortness of breath that occurs specifically when a person is lying down in a recumbent position and is relieved by sitting or standing.
which of the following residents is demonstrating orthopneic position? A resident sits in a chair with their back straight. A resident sits on the side of the bed and leans forward over a bedside table. A resident walks using a cane. A resident lays on their stomach. A resident lays on their stomach with their face to the side. 1, 2.
None of them.
A resident sits in a chair with their back straight. A resident sits on the side of the A resident sits on the side of the bed and leans forward over a bedside table. A resident walks using a cane. Correct. Orthopneic position is meant to assist in breathing. Leaning forward makes it easier to get air into the lungs. 1.
Okay, that makes sense, I guess. Orthopneic. So it's either laying down or. Okay, that makes sense. Let me take a.
Question 10 of 30. A resident is choosing items for breakfast. Which of the following items contains the most amount of potassium? Eggs, cantaloupe, toast, strawberries. A raft of
Cat.
partners.
Um. I have an idea, but I just want to make sure I'm right. I think it's cantaloupe. Actually, I think it's strawberries, actually. Yeah, cantaloupe. I was correct. Yeah, cantaloupe. I was correct.
Up, toast, strawberries. Correct. Cantaloupe is a melon that contains massive amounts of potassium. Other foods that contain high potassium include bananas and dark leafy greens.
Yeah, that's what I was gonna say. Bananas have a lot of potassium. Cantaloupe is the next best thing. Strawberries really don't, but strawberries are really healthy though.
Question 11 of 30. When helping a
Playtime
client
Foxy.
with left-sided
Said call Trevor Dunny.
weakness due to a CVA, the nurse. Question 11 of 30. When helping a client with left-sided weakness due to a CVA, the nursing assistant should position the client's cane in front of the client, on the left side, on the right side, away from the client. 1,
Im frucking stupid
2.
Margaret. Said no call Andy.
Question 12 of 30. CPR, cardiopulmonary resuscitation, should be performed when a client is unconscious, a client is choking, a client has no pulse and is not breathing, T has no pulse and is not breathing, a client has a pulse but is not breathing.
Okay, that's a fucking stupid question. A client has a pulse, but they're not breathing. If they're not breathing, then they ain't got no pulse. I'm just saying. Or no. No pulse means no breathing. So how can they have a pulse if they're not breathing? Or they're on, I guess they can, but they'll be on the edge of not having a pulse.
Question 13 of 30. A nursing assistant enters a client's room and finds a fire burning in a trash can. The nursing assistant's first action is to call the nurse for help, remove the patient, try to put out the fire, remove the patient, try to put out the fire, pull the fire alarm.
Oh yeah,
1, 2, 3. Pull
pull
the
the
fire
fire alarm.
alarm.
Pull the fire alarm. No! Okay, my professor was wrong about that too. Great. No, no. Damn.
Incorrect. The acronym RACE is used for fire situations: rescue, alarm, contain, extinguish. First, you must rescue the
No. 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 That's wrong. You pull the fire alarm, you grab your patient. As you're exiting the patient's room, you pull the fire alarm and get the patient out of the room. Ah, guys. Fucking hell.
What is a CNA? CNA certification. Question 1 of 30. The range of motion term abduction means moving the extremity away from the body, moving the extremity toward the body, moving the extremity above the body, moving the extremity below the body. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Current. Correct. Incorrect. Looking for more practice?
What the fuck?
Moving the extremity away from the body. Facilities chapel every Sunday.
Im fucking stupid Margaret. Said I.
Please do not ever make that noise ever again.
Yes. Avoid seeking assistance. Correct. Question 4 of 30. Which of the following would be a primary indication of hepatitis? Hypertension. E. Hypotension. Question 5 of 30. Which of the following aspects of care is important for a confused client? Checking the client's blood sugar every hour. Asking the client their name. Keeping the client contained. Melee mementos. 1. Terminally ill client. Death.
Im
Breathe
fucking
as
stupid
slowly
Margaret.
and deeply as possible.
Said I.
Have the client talk about the panic attack.
Ah.
Encourage.
Stop. That is a long ass definition. Come on. Oh my god, come
Encourage the
on.
client to verbalize their
No
feelings.
one
Ask the
cares.
client. During a panic attack, the question 9 of 30. Which of the following
Playtime
residents
Foxy.
is demonstrating?
Said
Bro.
rolling on the floor laughing.
What?
Demonstrating orthop. Which of the following residents is demonstrating orthopneic position? A resident sits in a chair with their back straight. A resident sits on the side of the bed and NT sits on the side of the bed and leans forward over a bedside table. A resident walks using a cane. A resident correct. Orthopneic position is question 10 of 30. A resident is choosing items for breakfast. Which of the following items contains the most P? Question 11 of 30. When helping a client with left-sided weakness due to a CVA, the nursing assistant should position the client's cane
Im
in
fucking
front of
stupid
the
Margaret.
client, on the left
Said
side,
I.
on the right right side.
Playtime Foxy.
Question 12 of 30. CPR, cardiopulmonary resuscitation, should be performed when a client is unconscious, a client is choking, a client has no pulse and is not breathing. Question 13 of 30. A nursing assistant enters a client's room and finds a fire burning in a trash can. The nursing assistant's first action is to call the nurse for help, remove the try to put out the fire. Question 14 of 30. Log rolling is a technique best used for which of the following patient diagnoses? Left tibial fracture, spinal cord injury, SCI, cellulitis of the right arm, psychosis.
I think it's spinal cord. Yes! I was right, bitch!
Cord injury, SCI, cellulitis of the
SCI, bitch! That's right. Hey. That's what, right, yeah. Right, yeah.
Question 15 of 30. When a client constantly ignores the urge to void, the client is putting themselves in danger of what complication? Constipation, incontinence, insomnia, poor appetite. When a client constantly ignores the urge to void, the client is putting themselves in danger.
I think it is that. Check. Developing incontinence.
Incontinence, insomnia.
Yep.
Question 16 of 30. Which of the following types of grief is considered a normal and healthy part of grieving? Anticipatory, complicated, unresolved, inhibited. 1.
The first one? Yes! That just stuck out.
Anticipatory, complicated.
That just stuck out to me.
Correct. Anticipatory grief occurs before the loss actually happens and is a normal part of grieving. Complicated, unresolved, and inhibited grieving indicate there is a problem with recovering from the loss. 1, 2, 3. Question 17 of 30. A patient is on a clear liquid diet. Which of the following is not allowed on this diet? Water, tea, coffee, orange juice with pulp. 1, 2.
Orange juice with pulp.
Orange juice with pulp.
I believe it's orange juice with pulp. Echo, can a patient on a strict, clear, liquid diet have orange juice with pulp? Echo, if a resident is on a liquid diet, can they have orange juice with pulp?
According to an Alexa Answers distribution, no. The pulp is cool. Put it clearly.
Question 18 of 30. A client with a Foley catheter is ordered to ambulate twice daily. Before ambulating the client, the nursing assistant should keep the bag below the bladder level, raise the bag above the bladder level, have the patient cover the bag with a pillow sleeve. Ask the nurse to confirm this order. 1.
Playtime Foxy. Said, can I have orange juice?
Keep the bag below the bladder level. Raise the bag above the bladder level. Have the patient
In
cover the
fruckin'
bag
stupid
with a pillow
Margarette.
sleeve.
Said yes Foxy thumbs up.
Question 18 of 30. A client with a Foley catheter is ordered to ambulate twice daily. Before ambulating the client, the nursing assistant should keep the bag below the bladder level, raise the bag above Question 19 of 30. Which of the following items is necessary in order to place a patient in restraints? The hospital administrator's approval, the charge nurse's approval, physical restraints, a physician's order.
Dick Sucker. Said thanks.
The fuck? Okay, I'm gonna have to mute chat. If you guys keep changing your usernames inappropriately, I'm gonna have to turn off my chat. So, I would appreciate ya if you guys would not change your names to inappropriate words, please.
Question 19 of 30. Which of the following items is necessary in order to place a patient in restraints? The hospital administrator's approval, the charge nurse's approval,
It's the charge nurse. I think it's
the
the
charge
hospital.
nurse's approval.
I think it's the hospital administration, though. Look.
Im fucking stupid Margaret.
Mm.
Said sleep
Order.
stream.
1.
Weary face. Sunny. Said sleep stream please.
Why? Why do you guys want to watch me sleep so bad? Weird. Weirdos. That means I actually gotta wear pants to bed? Wow. That's fucked. Aw. Gotta wear pants to bed?
Im fucking stupid Margaret. Said I've done one.
Yeah, if only you did it when that one incident happened. That way you would have evidence to show to your mom and to the police. Obviously not on YouTube, obviously. But still.
Question 19 of 30. Which of the following items is necessary in order to place a patient in restraints? The hospital administrator's approval, the charge nurse's approval, physical restraints, a physician's order.
Physician means doctor.
Question 20 of 30. A client eats a bagel and one large glass of orange juice. What is the correct way to record the amount of juice? For 180 cubic centimeters, 120 cc, 120 milliliters, 480 milliliters.
120 milliliters, I believe. Let me double check. $480 milliliters. Oh, it would be. Wait, a large glass?
Im fucking stupid Margaret.
Depends how large the glass
Said
is.
I drink cum.
That's okay.
1, 2.
How do you know? No, not okay. Especially at your age. No, that's not okay. No, that's bad. I mean, do what you do, but still, no, that's
Correct. The abbreviation of cc is no longer appropriate in the medical field. Only ml should be used. A large glass is 480 milliliters.
really a large glass is 480.
Im fucking stupid
Fuck.
Margaret. Said it was a AJ. Im fucking stupid
Huh?
Margaret. Said a joke.
Uh, it's not good to joke about, especially. I don't want to get in trouble because your age. So please keep the jokes to a minimum of age appropriate. Because all it takes is one person to see the comment, then report it, then I get in trouble. And I would like to keep my YouTube channel. So please. So remember, a large glass is 480 milliliters.
Question 21 of 30. One of the patients on the unit is on airborne precautions due to suspected tuberculosis. To rule out the disease, the doctor has ordered sputum specimens to be collected. What is the best daily time for the nursing assistant to collect the specimens? Before a meal, after a meal, first thing in the morning, last thing before the patient goes to sleep,
I believe it's
last thing
first.
before the
I believe it's first thing in the morning.
Im fucking stupid Margaret. Said I'd like to keep my YouTube channel too.
Yes! I
first
fucking
thing in the
knew it!
morning, last thing before the patient goes.
Yeah!
Correct. The sputum produced upon awakening is the most concentrated sputum and will yield the most accurate result. 1, 2, 3.
We got 1, 2, 3, 4, 5, 6 more questions, ladies and gentlemen.
Im fucking
Question
stupid
22 of
Margaret.
30.
Said I drink beer.
Like I said, please. Come on.
30. The nursing assistant walks into a patient's room and discovers him masturbating. Which
Sunny.
of the following actions is
Said me too.
correct? Scold the patient. Scold the patient. This is the second of our free CNA.
I'm gonna fuck you up! Stop messing up. Damn it.
Question 22 of 30. The nursing assistant walks into a patient's room and discovers him masturbating. Which of the following actions is correct? Scold the patient and tell him he should be ashamed of himself.
No.
Exit the room to provide privacy for the patient.
Yes.
Report the activity to the nurse in charge.
No. No.
Exit the room to provide privacy for the patient.
Yeah.
Report the activity to the nurse in charge.
No.
Ask the patient why he is doing this to himself.
Well,
Ask the patient why he is doing.
you might. No. Fuck. I'm gonna look up on Google.
Im fucking stupid Margaret. Said what's masturbating?
You know the answer to that. Don't play stupid. If you know everything else that came out of your mouth today, you would know the answer to that. Come on. Come on. What the fuck?
Im fucking stupid Margaret. Said is it jorking off?
Yeah.
Sunny. Said yeah.
Correct. Masturbation is a normal expression of sexual health. Attempt to exit quietly without disturbing the client in order to preserve his privacy and decency. 1.
So that means exit the room so they don't hear you. And normally, before you enter a patient's room, if their door is shut, you always knock really loud. You knock really loud, and you open their door slightly and say, CNA, I'm coming in. Are you dressed? Are you well? May I come in? And if they say, no, I'm busy, then say, okay, I'll come back. You just don't knock and then open the door. You open it slightly, and then, sometimes you just kind of look away a little bit because you never know what's going on. Because older people are still allowed to have sex. Unfortunately, some of them can, some of them can't, depending on how old they are and if they're able to do it without hurting themselves. But yes, old people are still allowed to get down and boogie. Um, there's, yeah, no, they have the right to do that.
Question 23 of 30. The nursing assistant cares for a client who is extremely agitated. She yells, screams, and frequently tries to bite staff. The nursing assistant should use restraints to ensure the client's safety. Speak calmly in an authoritative and neutral manner to the client. Use the television to distract the client. Provide care only when absolutely necessary.
Talk calmly.
Speak calmly in an authoritative.
Yes. Wow, I shit myself because I didn't look on Google.
Correct. Speaking calmly in a neutral manner can soothe an agitated client. Restraints are not appropriate for a client who is merely confused and can be
No, we
placated.
don't ever use
1.
restraints. It's actually against the law to use restraints on a patient in a nursing home, unless unless if the doctor says so. Actually, no. In certain nursing homes, in the nursing home that I'll be working in, it's actually a type of it's actually against the law to actually do that. It's restraining the patient, which could lead to a battery, harming the patient, and that's a federal crime. Um, and something that I physically didn't know, and I didn't know, and obviously I didn't know when I was learning, we were practicing in a practice situation.
Sunny.
Um,
Said do hospitals use restraints?
yes, in a hospital situation, the only one that can agree to a restraint is a doctor. You need the doctor's permission, the physician's permission to use restraint. Otherwise, you cannot just put a restraint on a patient. But I was buckling a patient, and I didn't know that you're not supposed to, but I didn't get in trouble. I was learning. So, but now I know because my teacher told me, no, can't do that. Like, oh, I didn't.
Question 24 of 30. A client with a terminal illness tells the nurse that he has begun praying every night. The client states, "If I pray every night, God will forgive me." This represents which stage of grief? Acceptance, bargaining, denial, anger,
Accept,
acceptance.
believe so. Oh, bargaining. Really?
Bargaining. Denial. Anger. Correct. This patient is bargaining to be forgiven in order to cure his illness. This is a
Oh,
normal stage in the grieving process.
I didn't know that. I'm gonna take a picture of that though.
Question 25 of 30. Which of the following pieces of assistive equipment would be most helpful in moving an immobile client from their bed to a chair? Mechanical lift. Draw sheet. Gait belt. Wrist restraints.
Im fucking
1,
stupid Margaret.
2,
Said
3,
I'm in denial about
4,
my exes.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Question 25 of 30. Which of the following pieces of assistive equipment would be most helpful in moving an immobile client from their bed to a chair? Mechanical lift. Draw
Yeah.
sheet. Gait belt.
Also, if you guys want to know what a gate belt is, a gate belt is, where is it?
Im fucking stupid Margaret. Said do y'all have an etch-a stitch?
Here. This is a gate belt. This is a gate belt. This is a gate belt. A gate belt is used like so. It goes around your patient's waist. It actually goes on like this. Once they say that that's tight enough, then you pull it tight. You want to make sure 2 fingers can get in there, and then you have the patient sit. The patient will be sitting in a
Im
sitting
fucking stupid
position.
Margaret. Said I'm eating candy.
That's
Im fucking
not good.
stupid Margaret. Said nom nom.
Patient is sitting in a sitting position. You have your gait belt on. You as the patient, will sit until
Sonny.
and
Said what kind of candy you eating?
until the nurse tells you to stand up. You, the patient, are gonna grab your arms and put your arms around the patient's neck. I mean the nurse's neck, like this, and the nurse is gonna grab the gait belt, interlocking the fingers underneath the gait belt, and then on the count of 3, the nurse will bend her knees or his knees and stand up, and patient will stand up, and you, as the nurse, one hand on gait belt, other on
Im fucking stupid
shoulder,
Margaret.
and walk.
Said fruity mad science many choose strawberry.
That's how that's done. You guys were not listening, so, but that's okay. I'm sure you were. I hope this is the correct answer.
Im fucking stupid Margaret. Said I listened.
That's good. In this situation, it's a mechanical lift, apparently.
Al lift. Draw sheet. Gate belt. Wrist restraints. Correct. A mechanical lift should be used for a mobile or NWB residents. A gate belt should never be used on an immobile resident to lift them and should be used on
Sonny.
individuals who are
Said I didn't.
FWB or PWB. 1.
Im
I
frucking
did
stupid
eat.
Margaret. Said haha.
I did eat, correct? Yeah, I did. One, two, three. We got three more questions. Oh, three. Oh, we got five more questions. Jeez.
Question 26 of 30. The nursing assistant prepares to give a patient a bed bath. Before turning the patient to rub their back, the nursing assistant notices that he has a Foley catheter in place. Where should the nursing assistant secure the catheter to ensure it is not pulled during the bath? To the lateral aspect of the patient's thigh, to the bed sheet, to the medial aspect of the patient's thigh, to the bed. 1.
Over the thigh. They say they do this stupid shit. They just can't say the correct term. I fucking hate it.
Im frucking stupid Margaret. Said at Donny Russo 6702 how sreu saint? Im frucking stupid Margaret. Said sane asterisk. Im frucking stupid Margaret. Said BRB.
Which answer is correct?
Im frucking stupid Margaret. Said back my NI.
You can't say that. Don't say that. Unless the text to speech might have mispronounced your word, but it sounded kind of bad.
Correct. Securing the catheter to the lateral aspect of the patient's thigh ensures it cannot be painfully pulled during the bath. 1.
Im frucking stupid Margaret. Said I'm Native American.
Okay. By how much percent? Because if you're like over 75%, you'll be able to go to college for free for like 6 years. I would look into that. That'd be cool.
Question 27 of 30. A patient has just received news about the death of his spouse. He states to the nursing assistant, "I can't believe this has happened to me. I don't know what to do. How can I live without my wife?" The nursing assistant best responds by stating, "You will need more time to cope with this loss. I understand you're in pain. I'll stay with you. This kind of thing will happen to everyone eventually. Do you and your wife have any
Fucking
children together?
stupid Margaret. Said I don't know how many
Understand you're in
percent.
pain. I'll stay with. Do you and your wife have any children together? 1.
Before you go to college in a couple years, I would look just to see, because if you are over 75%, depending on what state you live in, you might be able to go to college for free.
Fucking stupid Margaret. Said I'm in California, smiley face.
California, so yeah, I believe
Sunny.
California still does it.
Said yeah and I.
Yeah, I believe California still says it, like, does that. Because I know Michigan does. I'm in Michigan, so, yeah, no, I think it does. You'll have to look into it when you're at that time.
Fucking stupid Margaret.
Correct.
Said Sunny.
This is the best answer because it reflects what the patient is feeling, pain, and stays with the patient to comfort him.
Yeah, Sonny, you're white, bro. I think. 3 more questions, and I gotta fucking piss.
Question 28 of 30.
Fucking
The
stupid
nursing
Margaret.
assistant
Said do.
helps a patient who recently had a right-sided stroke to bathe. The nursing assistant helps a patient who recently had a right-sided stroke to bathe. Which of the following describes the best method to support the patient's independence? Allow the patient to perform as much of the bath as possible. Ask the patient what he wants to do. Complete the entire bath for him to conserve his energy. Encourage the patient to do the best he can to clean himself.
I think it's the last.
Age the patient to do the best he can.
Fucking stupid Margaret. Said what's up my NI. Sunny. Said sup.
Yeah, that's what I thought too. Wow! Well, what's the difference then? I'm not restarting. Kiss my ass. I don't want to restart, bro. I was so close! Fuck.
Sunny. Said Applebee's.
Ooh.
The nursing assistant allow the ask the complete encourage incorrect. It is best for the question 29 of 30. A resident comes out of their room saying they have burned their leg
Fucking
after they
stupid
dropped
Margaret.
hot soup on it.
Said a plebei's my ass.
It. The skin looks blistered and red. The nurse assistant knows this is a superficial burn, partial thickness burn, total thickness burn, serious burn. 7. 30.
Okay. I didn't know that. Okay. Fuck you.
Sunny.
Question 30 of 30.
Said
a client who has not had a bowel movement in 4 days would receive the most benefit from which of the following procedures? Endoscopy, colonoscopy, catheterization. Colonoscopy, catheterization, enema. Incorrect.
Oh, fuck! It was enema. Okay. Yeah. Okay. Alright, guys. I'm gonna go to bed. I'm tired. A sleep stream. I'll have to think about it because I don't know, my computer really can't run
Sunny.
all night.
Said
Yeah, my computer really can't run all night. So, yeah, there's that.
Fucking stupid Margaret. Said oh okay. Sunny.
Yeah.
Said I. Fucking stupid Margaret. Said I. Fucking stupid Margaret. Said I. Fucking stupid Margaret. Said I.
Anyways. Mhm. Uh-huh. Anyways, thank you guys so much for watching. I appreciate it. I will be doing another stream. I'm gonna be doing streaming test streams like this for the next little while. It just gives me something to do. No matter what, I'm getting a video out, which I really want, and I'm also getting a yeah. I'm getting out content for you guys, and I'm also doing what I need to do. So, yeah. Wish me good luck. I want everyone to think positive throughout these few months, throughout these few weeks that I'll be studying. I want everyone's positivity, no negative, no negative. I'm not playing around and I'm not joking when I say this. I want nothing but positivity. If I ever see, like, I'm being dead ass when I say this, and I will do it. If I see any negativity in the chats or on comments of any negativity, I will permanently ban you from the channel. I promise you that. And I am not playing when I say that. I don't want this channel to be negative. I don't want nothing to be negative. So if you think it's funny to say a joke like, oh, okay, cancel, I will put you in time. I will put you permanently in time. So. So just please be So just please, please, please be respectful. Please pray for me. And just allow me to just have the confidence and just give every visual and just everything nice, everything good, everything. I want positivity in the chat. So glad my text to speech is not on. Why are you guys being inappropriate in chat? Stop being inappropriate. You're fucking. Anyways, thank you all so much for watching. I appreciate it. Love you all. Stay healthy, stay safe. Oh. The fuck are you doing? Stop making weird noises in chat. Hello. Here, I'll turn on text to speech just for a minute before I end. Anyways, but yeah. So positivity in the chat, please.
Im fucking stupid Margaret.
Positivity.
Said ah. Im
Not.
fucking stupid Margaret. Said ah.
I will be. But anyways, guys, thank you all so much for watching. Like I said, please just.
Im fucking stupid Margaret. Said ha ho ha.
That.
Lol betwulfy 0000. Said hi Donnie.
Hi, Willie. Hi. But anyways, for the next
Sonny.
couple weeks, just
Said hi Wolfie.
just
Im
be
fucking stupid
kind.
Margaret.
Be kind, please.
Said ah.
Snowy, I'm gonna put you in timeout if you keep doing that. Quit doing that.
Lol betwulfy 0000. Said sorry that I am late. Im fucking stupid Margaret. Said harder Donnie harder.
What the fuck?
Im fucking stupid Margaret. Said no timeout.
Why? Jesus. I hope my next employer does not look at my YouTube history. It's about, oh, it says here that you have an inappropriate chat. There's a bunch of like random teenagers saying your name weird. Why is that? I'm like, I don't fucking know. I don't fucking know. Oh, jeez.
Lol betwulfy 0000. Said okay Donnie did you got the chapter yet? Lol
I did
betwulfy
not. I'm studying.
0000. Said from FMR.
I didn't get a
Im
chance
fucking
yet.
stupid Margaret.
I probably won't
Said
though.
Donnie go faster.
Can you not do that, Sunny?
Im
I mean,
fucking
Snowy?
stupid Margaret. Said ha 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 ha.
Nah, okay.
Sonny. Said I'm not a teenager for the last time.
You are a teenager. You're 18. 18.
Im fucking stupid
Until you don't
Margaret.
hear the teen.
Said I'm a preteen. Im fucking stupid Margaret. Said to he. Lol betwulfy 0000.
Shit.
Said GM. Lolbitwulfi 0000. Set GN.
Right. But no, I won't be able to play that game for a couple weeks, maybe a month or so.
Sunny. Said I am not. Im fucking stupid Margaret. Said Donnie go faster off faster.
Why are
Im
you
fucking
saying
stupid
that,
Margaret.
bro? Ew.
Said ha ha ha.
Yo, I'm gonna put you in timeout. Stop, I'm being dead ass. Weird. It's a little weird. I'll take your. I'm not. I'm just gonna start taking
Im fucking
moderation
stupid Margaret.
away.
Said Nulu.
I'm just gonna start taking moderation privileges away from people.
Im fucking stupid Margaret. Said PLS no.
Be good. If you cannot obey the rules, then you will be punished with no moderation. No moderation. Punishment.
Im fucking stupid Margaret.
And no, it's not a good
Said
punishment.
okay fine.
Okay, and no, it's not a good punishment
Sunny.
either.
Said you're fired. Im fucking stupid Margaret. Said one last one.
Fine. Just one last one. Don't make it weird, please. Hi.
Im fucking stupid Margaret. Said Donnie harder and faster. Im fucking stupid Margaret. Said he.
Y'all gonna get me in trouble, bro. I swear. Y'all are fucking crazy. Shit.
Im fucking stupid Margaret. Said okay that was the last one. Im fucking stupid Margaret. Said or is it?
It better be. No more inappropriateness. I don't want to get in trouble.
Sunny. Said Im fucking stupid Margaret. Said Im fucking stupid Margaret. Said Im fucking stupid Margaret.
I'm just gonna do that. Mm-hmm. Alright. I'm sorry. I had to put you in timeout because you weren't listening. Told you 3 times to stop that, please, and you refused. Sorry. Anyways, but yeah. So basically, what's going on? I'm going to be doing streams every night that try to motivate myself. The only way how I can motivate myself into getting studying done is to stream it. Why that is because number one, I get content out for you guys, but I get content out for you guys, and I also am doing my studies. So whether that's, whatever I'm doing, but I'm gonna be doing it. And there might be some times when I won't be able to stream because of certain situations, but I'm going to try my best. So with that being said,
Sunny. Said what games you playing tomorrow?
I'm not playing no games tomorrow. I'm just studying. That's another thing I'm gonna get to right now. I will not be playing any games at this time, just because just because um just because I need to get my studying done. So that's where that is right now. So I'm gonna get my studying done. I'm still doing my workout. I gotta do my workout before I go to bed. I know yesterday I did not set my alarm. I should have, because I slept in to like 12:30, which is terrible. Um, but I've been waking up and going to bed on a strict schedule. I'm trying my best. So I'm gonna try to go to bed. Actually, it's almost past my bedtime. No, it's not. I got an hour to myself. So I'm gonna end the stream.
Im fucking stupid Margaret. Said via gudved. Im fucking stupid Margaret.
Uh-huh.
Said yay I am out.
Uh-huh.
Im fucking stupid
You be good
Margaret.
now.
Said, smiley face. Im fucking stupid
Now you
Margaret.
be good.
Said no.
You be a good person. Stop being bad. Anyways, okay, next violation is moderation takeaway. That's my new rule. You get three tries and you're out. Actually 4. 3
Im
chances and you're
fucking
out.
stupid Margaret. Said he'll be a good girl. Sunny.
Perfect.
Said out of prison. Im fucking stupid
Prison.
Margaret.
Oh, please.
Said no.
Out of prison is crazy. That's crazy. First is a warning. A verbal warning is 1. Number 2 is a timeout. Number 3 is moderation takeaway if you have one. And number 4 is permanently banned from the channel. Or it depends. Actually, no. It's just it goes up to the times. You get timed out for 1 minute, then 2 minutes, and then once I'm not able to time you out for like some amount of minutes, then it's moderation takeaway, and then it'll be channel ban. I've already banned 3 people so far in the past couple years from the chat. So so yeah, but so anyways, I'm going to bed. I'm tired and I want to relax and play on my phone before I go to bed.
Im fucking stupid Margaret. Said call me a good girl. Im fucking stupid Margaret. Said Tahi.
Legally, I cannot say that. You are a very good person. That's all I can say. I can't say what you want me to say. I'm sorry.
Im fucking stupid Margaret. Said okay wait don't time K. Sunny. Said anyone who violates my channel is going to prison instead of ban.
Oh, I have chat here on my screen. Oh, that's cool.
Im fucking stupid Margaret. Said Sunny ill violate you. Im fucking stupid
What is
Margaret.
this chat?
Said free food.
It's free food. Yeah, it's terrible food. Don't ever go to prison or jail. It's terrible food. Promise you. I promise you that. It's terrible. Mommy milkers. Oh, oops.
Sonny.
Mommy milkers.
Said to El Salvador prison.
What the fuck is wrong with
Him fucking stupid Margaret. Said mommy milkers, yes.
Yep, I have some.
Johnny Superbomb.
I am fucking hell. Yo. Yo, what's up, bro? Hello?
Him fucking stupid Margaret.
I'm testing
Said
right
it's
now.
coming.
Hmm?
Him fucking stupid Margaret.
You're
Said
breaking
yell it's
up.
coming.
You're breaking up. I can't hear you. What'd you say? Oh, I'm testing for my CNA. I'm just taking the practice test. Yeah, that's fine. Mm-hmm. Old lady, that's crazy.
Him fucking stupid Margaret.
Oh no, you
Said call me a
did.
good girl, Sonny.
Oh no, you did. Don't worry, I ain't got no packet. I ain't got no packages coming in. That that
Sonny. Said be a good girl.
that sounds good, bro.
Him fucking stupid Margaret. Said I will if you call me one.
What you mean, play on my PC? Yeah, I'm on my
Him
PC right
fucking
now.
stupid Margaret.
I was
Said
testing,
mommy
but
Mikers.
I'm
Sonny.
testing. As I was
Said I
testing,
just did.
I started my stream. I started to stream, so I'm streaming
Him
while I'm
fucking stupid
testing.
Margaret.
No, I'm
Said
streaming
nuh.
on YouTube right now. On YouTube. I just finished my test not so long ago, and I was just about to end. I'm I'm fucking tired. I'll probably be sleeping by
Him
then.
fucking stupid Margaret. Said mommy milkers.
I'll be sleeping. I'll probably be sleeping by then. But you can try. But I mean, you can always try to call me tomorrow though.
Sonny. Said say ah while he's
This is
on the
the second
phone.
results. 27.
Huh. Yo, I don't know if you heard me, but I'll probably be sleeping. But I'm getting ready
Him
for bed
fucking
right
stupid Margaret. Said say it's coming to the phone.
now. No. Anyways, I'm going to bed, guys. I love all of you. You guys are all perfect human beings, and you guys are perfect, and you guys are wanted. Yeah. So you guys are all loved. You all are good, very good individuals,
Him
and this is
fucking
a race
stupid
for you.
Margaret. Said nuh.
Yep.
Him fucking stupid Margaret.
Yep.
Said I'm a bad girl.
Okay. Well, you be a bad girl, I guess. I am going to bed.
Him fucking stupid Margaret. Said don't leave.
I have to. Tired.
Him fucking stupid Margaret. Said it'll be lonely.
Well,
Fucking stupid Margaret. Said you're a grape. Sunny. Said can I see your search history? Fucking stupid Margaret. Said yes Sunny.
Alright guys, no, for real
Fucking
though. Look,
stupid
I gotta
Margaret.
go.
Said it's full of anime girls.
Alright, chat. Well, I will see you tomorrow. I love all of you. You guys are perfect. And I appreciate all the love and support. Make sure, if you haven't already, go into, actually, like the stream. I want to see how many of you like this
Fucking
stream.
stupid Margaret. Said love yat.
Can y'all
Sunny.
can y'all give the
Said
stream
don't
some love?
leave. Fucking stupid Margaret. Said I suck cum.
That's disgusting. But I don't judge. I don't judge, but it's a little disturbing.
Fucking stupid Margaret.
Come on.
Said he.
Come on. I need more people to like the stream. Come on.
Sunny. Said I.
Come
Fucking
on.
stupid Margaret. Said I am joking.
Come on.
Fucking stupid Margaret. Said I.
Come on. Not that type of like. Like the video. Not heart. Like. Down below. You know, next to the subscribe button.
Fucking stupid Margaret. Said ha 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 ha.
Okay. Well. Okay. Not that type of light. Go right here. Right here. This button right here. See? This button right here. Right here. Damn it. Damn it, children. I'm gonna leave. Alright, I'm leaving. Bye.
Fucking stupid
Bye.
Margaret. Said pussy.
Bye.
Sunny. Said yeah.
Bye. Bye.
Fucking stupid Margaret. Said bye ye. Sunny. Said ahhhhhhhh.
Where's this to? Oh, it takes me to the donation. Oh yeah, you can donate. Really? Tip. Username. USD. What does it go into? Oh god, that's interesting.
Sunny. Said I.
10, 30, 50, 100. That's crazy. Monthly? What the fuck? That's cringe. One time? What the fuck? You could do up to 25 characters? That's great. That's great. Ah, it's fucking funny. Ew, Betty Boo. Ew. That's cool. That's pretty cool.
Sunny. Said get up Donnie. Fucking stupid Margaret. Said do the Betty Boop one. Sunny. Said porn yay.
You guys could donate if you wanted to. Not obligated. You're not obligated to donate.
Him fucking stupid Margaret. Said I let him say that.
Anyways, I am going to bed. I am extremely tired. How many subscribers do we have? Let's see.
Him fucking stupid Margaret. Said no.
Oh, that sucks. I can't help it. I am tired. We have 163. Nice. You want to know what we don't have no more? That fucking violation. Fuck yeah. No more violations.
Sunny. Said last one. Him fucking stupid Margaret. Said NGHHHH.
Mm-hmm. That's private anyways. Yeah, this video right here.
Him fucking stupid Margaret.
It got banned.
Said Sunny say something bad.
No, don't you dare.
Sunny.
Too late. This is my most viewed one. That has almost 50,000 views. Holy shit. I've gained almost 200 subscribers from that. Fuck yeah. It went all the way down. Oh. Oh, these, my boobies, my so fucking titties. This one also got a lot of views. 40.6. I got 125 videos.
Oh, these? My boobies? My massive fucking titties? My super stuffed up milkies? My hunger bonger doinky boinkies. My fucking fabric stretching wind flapping gravity well insect clone. You mean these super duper ultra hyper god
Okay, the weirdo. So then it started going downhill like right here. Like right here.
keys?
Why? Perfect. Freedom of speech. Anyways, I love y'all. I'm really going to bed this time. I'll see you tomorrow. I promise. No whining, no crying, no nothing like that. No, no, no. No, 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 no crying. Sorry, I got to. But anyways, I love y'all. You can go watch the rest, a lot of other mob videos. I promise you, I got so many videos on the channel. I am tired. That didn't sound right. I'm gonna fucking warm up my hands. Hands are fucking cold. You're lonely. I'm sorry. I'm tired. Nice to meet you. Sorry, that was terrible. Bye. So lonely. I have nobody to call my own. I can't. I do have to go to bed. I gotta get up early and do my stuff. You will be fine. I promise. Oh, I found a sticker. Sticker. Ah, wait. Oh, that's cool. You see the green light? You see the red light? That's pretty cool. No, that's not a vibrator. No, and no, it's not. Nice. Bye bye. 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 See you soon. Bye. Soon. Well, I have two children. Children of the corn. 4 children. Why? Do you guys miss me that bad? I'm tired. What are we gonna be doing? If I'm staying, I gotta go to bed though. I can't. I physically can't stay up at any longer. Yeah, I have to go to bed here in the next few minutes. I won't be able to do it. I can't do a sleep stream tonight. But I will say this. I will make a wager. If and when I pass my CNA exam and I'm able to become a certified CNA to celebrate, I will think about, I'm not making a promise, I will think about doing a sleep stream to celebrate. But in order for that to happen is I have to stay grounded, and plus like I still got to do my workout. I'll do my workout. But after my workout, I am going to bed. I'll do my workout while I'm on chat. But after my workout, then I gotta go to bed. But I had to use the restroom.
Fucking stupid Margaret. Said sexy Donnie. Fucking stupid Margaret. Said come. Fucking stupid Margaret. Said shit. Fucking stupid Margaret. Said balls. Fucking stupid Margaret. Said fuck. Fucking stupid Margaret. Said hell. Fucking stupid Margaret. Said FHDHYDGYVDGHVDGBVD. Fucking stupid Margaret. Said harder. Fucking stupid Margaret. Said NGHH. Fucking stupid Margaret. Said she. Sunny. Said sleep stream.
Now, if y'all keep asking, I'm not gonna do one at all. Please stop asking for a sleep stream because it's not happening.
Fucking stupid Margaret. Said jidgid ftijgij jigdji higd vigd. Fucking stupid Margaret.
Y'all having a stroke.
Said hugid gaiigdiotiojude. Fucking stupid Margaret. Said uajij yugdu ugdu agud jaguid. Fucking stupid Margaret. Said igdug yashguz gujegu. Fucking stupid Margaret. Said gihig veged good.
English.
Fucking stupid Margaret. Said vig gio exio gio. Fucking stupid Margaret. Said ditch good. Sunny. Said lll stop. Fucking stupid Margaret. Said vihas jaya husbawiv. Fucking stupid Margaret. Said glitch jugged vade vajid. Fucking stupid Margaret. Said bujuhuj jug. Fucking stupid Margaret. Said sveda hidhad. Fucking stupid Margaret. Said iohuiwihio egg. Fucking stupid Margaret. Said hunajawi. Sunny. Said lil stop asking. Fucking stupid Margaret. Said uayahui gabeove. Fucking stupid Margaret. Said okay good.
Please stop spamming chat, please. It's a little annoying.
Fucking stupid Margaret. Said the bad stuff I typed in chat is gone. Fucking stupid Margaret. Said very good. Fucking stupid Margaret. Said blabay blablabel. Fucking stupid Margaret. Said ag. Fucking stupid Margaret. Said sexy Donnie.
What?
Fucking stupid Margaret. Said he doesn't know a thing I say. Fucking stupid Margaret. Said sexy Donnie.
Thanks, I guess.
Fucking stupid Margaret. Said he knows what I say. N.
dude. Fuck, that hurt. I didn't want to stop. Damn. I felt it in my lower back. Fuck. Fuck, fuck. Yeah. Hello. Hey. Still streaming. Well, I just got done with my test. I was testing while I was streaming. How'd that go? It's going good. I'm doing my workout on stream. Oh, I'm sorry if I. No, you're good. I was testing. I was doing my test call.
Im fucking stupid Margaret.
Yeah.
Set JJ Jejegard Sig J Rthoidieft 4 I7 YTF 4 YK7 to 7 OI 55 ETH 5 to you.
Fucking weird. Tell your team I said, hey, yo, come on now. I can hear you.
Sonny. Said Big Daddy.
Yo, who the fuck said that?
Im fucking stupid Margaret. Said Daddy Donnie.
Yo, y'all are fruity. Cause I'm taking my shirt off.
Im fucking stupid Margaret. Said we simps.
Fuck.
Sonny. Said go ahead take it off.
Fuck you.
Im fucking stupid Margaret. Said Daddy Donnie.
Damn. Yeah, I know I'm everyone's daddy. That's a crazy statement. I'm not a dad yet. Yeah, I know they did. They enjoyed it too. Look, they're putting fucking sexy emojis. I got kids in my chat putting sexy emojis. Like the hot sex emoji. Yo, it's crazy. Y'all are clowns. I am not putting on a bikini. You're fucking insane.
Im fucking stupid Margaret. Said pregnant woman. Im fucking stupid Margaret. Said I am a make you have my babies.
Yo,
Sonny.
that's fucking crazy.
Said what did you just say to me? Say sorry Donnie.
That's fucking crazy. Yo, I just had an 11-year-old tell me they're gonna impregnate me. How is that possible? The fuck? That's crazy. Y'all are fucking insane. I'm just being dead ass. Y'all are fucking crazy. Something ain't right with y'all. Especially the 11-year-old in my chat. Sometimes I think she ain't
Im
11.
fucking stupid Margaret. Said mommy Mikers.
Yo, it's okay. I got better titties than. Hey, at least my titties are real. Not like some people's. I got real mommy milkers and a real dumpy. Watch out. Bitch. Now I'm posing in front of the camera. These fucking fiends, these silly billies are taking photos.
Fucking stupid Margaret. Said Daddy Dumpy.
Daddy Dumpy is crazy.
Sonny.
Yo.
Said join WWE Donnie.
Yo. No. I am not jumping. Now they're putting eggplant emojis. Y'all are fucking crazy. I pissed on myself. They are. They're fiends. Make a OnlyFans, they say. Fuck that.
Fucking stupid Margaret. Said I'd definitely watch WWE if Donnie was in there.
Now they're
Fucking
saying they
stupid
would watch
Margaret.
WWE if I was
Said
in there.
eggplant.
Fuck yeah,
Fucking
though.
stupid Margaret.
Hey.
Said eggplant. Fucking stupid Margaret. Said eggplant.
Why are we saying eggplants now? Stop. Thanks for not making me insecure. Appreciate it. Donnie,
Fucking
what?
stupid Margaret. Said Daddy Dick.
Daddy Dick is
Sonny.
crazy.
Said waning gibbous moon.
Yo! Y'all are fucking crazy. I smell like shit. Dude, I smell like a box of fucking fresh, brand new box of crayons. That's what I fucking smell like. That's crazy.
Fucking stupid Margaret. Said I'd smell you.
You would smell me? Tasty? He
Fucking
tastes
stupid
good.
Margaret.
Yo!
Said for free.
You would taste me for
Sonny.
free is crazy.
Said full moon.
That's crazy. I'm not showing the moon. These pants are falling down. Y'all are fucking fiends. I'm being dead. They also, I got a tattoo as well. Damn. My titties are popping.
Sonny.
I'm just waiting for these
Said the
fucking...
new show meet.
Fucking hell. I knew it was coming. That's why I stopped. This is a bad position. I don't want to hear anybody say anything. I will put you in timeout. Don't you say it. I will put you in timeout. Don't.
Fucking stupid Margaret. Said show us them melons.
No.
I'd eat those melons.
Yo. Bro. Yo, this 11-year-old is really educated for being 11. Can someone check this kid's ID? This kid's in fucking calculus.
Stupid Margaret. Said it to the bathroom.
Yo, that's crazy. Do not take me with you to the bathroom. That's fucking crazy. That's fucking crazy. I don't need another fucking... Who was that guy? Sonny. Who was that guy that fucking said them inappropriate things
Sonny.
to me?
Said I can call the cops Donnie. Fucking stupid Margaret. Said I am a meet you to my toilet.
You're gonna meet me on my... What? You're watching me from the toilet? That's... Okay. Well, at least you're on the toilet this time and not pissed yourself. Yeah, I was talking yesterday,
I'm
and
fucking
apparently
stupid
I made this
Margaret.
person piss themselves.
Said okay, I am a head to the bathroom.
Don't have an accident. Yeah, go to the bathroom. I'm just gonna do workout. This is a sports bra. It is not. It is daddy's shaper tank for big daddies like me. Ah. Now, if you excuse me, big daddy, big sexy, got to do his push-ups. I need to get better. I used to just do knee push-ups, but I need to start doing like actual push-ups. My armpits are fucking
Sonny.
hairy.
Said daddy long eggplant.
Am I even what?
I'm
How?
fucking stupid Margaret. Said I pissed myself.
You piss mizzled? How? You had one job. You had one job to make it to the toilet. You had one job. I'm just gonna get a random email one day from someone's mom saying, "You gotta calm down a little bit. You keep making my kid piss himself." Sorry, not my intention. Your kid just has a loose bladder. My Where's my defense at? This is not my defense. Where's my blocker and everything? There's no titties to play with. Can't play with these. At least not with this tank top on. Oh look, it's my wolf mask. Y'all see? The Halloween
I'm
mask.
fucking stupid Margaret. Said I am a piss on your bed.
You're gonna piss on my bed? Please don't. That's weird. Weird as fuck.
Sonny. Said long titties.
Shut up, bitch. Hey, just because my titties are better, don't mean nothing. I may have a big ass, some titties. That makes me a good person, though.
I'm fucking stupid Margaret. Said long dick.
Jesus Christ. Oh my god. Why are we talking about this? Guys are fucking weird. Donnie's OnlyFans. What the fuck? What was that? No, I do not have an OnlyFans. Fuckers. That'd be fucking weird.
Sonny. Said okay stop.
For real, though.
I'm fucking stupid Margaret. Said what's your OF?
I don't have an OF, though. That's crazy. I don't have an OF. Andy, do I have an OnlyFans? Nope. No. And plus, you guys wouldn't be able to subscribe to it anyways. Because, yeah, no. That's inappropriate. There's people that say I should make one. I'm not going to. I don't want to sell my body like that. Watch, I say that, and then one day I make one. But if I do make one, I'm going to be like Markiplier. That just posts random shit. He doesn't even post nudes. He just posts surfing videos. I feel like that'd be funny. Just make an OnlyFans, make the cover photo like really spicy, and then just make people subscribe for $10 a month.
Sonny.
And then all the videos
Said
are
I don't
just
give a
normal.
fuck.
See? You're just jealous, Sonny. Fuck. I'm like fucking struggling to stay awake. I can't even do my push-ups. Fuck.
Im fucking stupid Margaret. Said take off your shirt.
No,
Sonny.
I'm not doing that.
Said I'm mad.
I'm not taking off my shirt. Weird. I'll probably get demonetized by YouTube because I got big fucking mommy milkers. Come on, I got 3 more push-ups to do. Ah! Fuck. Long dick, big nose, all the chocolate on the floor. You know what would look really good on me right now? This. Damn. Damn, I look hot. Yeehaw, bitch. Ride 'em, cowboy. Yeah. Oh, you know what would look really
Im
sexy?
fucking stupid Margaret. Said my grandma scared what I was doing skull.
Your grandma saw what you were doing? That's crazy. How embarrassing. We're just gonna put this on. This is what my teacher gave this to me. This is a unicorn apron. My teacher gave me this. Andy got one too. Should I put the
Sonny.
apron on?
Said saying inappropriate stuff.
Aw, damn. How
Im
much
fucking
money?
stupid Margaret. Said no, my grandma asked what I was doing.
Oh. How much money do you gotta put in the jar now? Grandma, I tried telling, Grandma, I tried telling her. She don't like to listen. I tried. Make her put an extra $10 in that jar. She was extra bad. Grandma's gonna make me put money in the jar now. I'm just gonna wear the pink apron.
Im fucking stupid Margaret. Said I am a be in department. Andres Quintanilla. Said rolling on the floor laughing, rolling on the floor laughing,
Yes,
rolling on the
Daddy.
floor laughing, rolling on the 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 floor laughing.
Should I
Sonny.
just wear the apron?
Said tell your grandma what you were doing the truth. Im fucking stupid Margaret. Said nuh-uh.
There we go. Nah, this should be the cover photo of my OnlyFans. Just a pink apron. Wow, we got extra views. Hi, children. Hello, children of the Quran.
Im fucking stupid Margaret. Said making one for you RN. Sonny. Said be a good girl and tell her. Im fucking stupid Margaret. Said JK. Im fucking stupid Margaret. Said nuh-uh.
Oh, there's pockets in here. I didn't even know. This don't look right. I should get my hands on my pocket. Ah. Someone told me I should just do only apron. I'm not doing that. If we hit
Sonny.
2,000,
Said do you want to call the FBI?
no.
Fucking stupid Margaret. Said was your teacher sexy? Sonny. Said asterisk me.
Yeah. She was
Fucking
alright.
stupid
She
Margaret.
was nice.
Said no weary face.
Was my teacher sexy? She was pretty, I guess. I don't know how to answer that. I don't know how to answer that without being weird. I didn't really look at my teacher like, oh yeah, I'm gonna fuck you one day. She was also in her 40s with kids and a husband. And she watches my YouTube. So no, I did not think of my teacher like that. Sorry. I'm sorry. Fuck. Imagine she just spawns in the chat. She's like, Donald? I was like, Jesus, I'm dead. No, my teacher was a
Fucking
very
stupid
pretty
Margaret.
woman.
Said oh yeah I'm gonna fuck you one IOMLLLOL ha 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 ha.
What the fuck? Bro, this kid really fucking is desperate. That's fucking insane. I'm not a Diddy. I'm no Diddy. Punk.
Sonny. Said yes or no I will call the FBI or tell your grandma.
Oh. Look, I'll be on, I'll make y'all a
Fucking
deal.
stupid Margaret. Said I just told her.
I'll make y'all a deal. If we hit 2,000 subscribers before my birthday,
Fucking stupid
what
Margaret.
should we do?
Said I told her I was being zesty.
Yeah, like she's gonna understand that. Unless her grandma be killing it at like Call of Duty. Low key, your grandma's like playing Call of Duty when we're all sleeping. Like low key. My grandfather does. My grandfather's almost 70 years old and he's playing COD. He's been playing COD since it came out. I'm gonna put this apron on so people stop staring at me.
Fucking stupid Margaret. Said she has that diva.
That's crazy. I was right. Grandma be cranking it at Call of Duty at nighttime. That's crazy. How many win streaks does Grandma have? 100. Imagine Grandma says she got 100. The furry costume. Oh
Fucking
yeah,
stupid
right here.
Margaret. Said she's 70 skull.
Damn, that's pretty young. Tell your grandma she's still young and kicking. Pretty woman. With all the respect in the world. Time to get a whipping. Whip it good. Someone told me put the furry costume on. I'm not putting on my furry costume. I gotta get it fixed. I gotta get the tail removed.
Fucking stupid
I gotta
Margaret.
get the table
Said I told her you're still young and kicking.
back. She's still young and she's still kicking. Very beautiful woman. Tell your grandma. Tell your grandma I said she a very pretty woman and that she's still kicking and a bunch of nice. I gotta get the head removed. I don't want this. I'm gonna get this removed. Get the tail removed. Get the buttons removed. Put a zipper on. And call it good.
Fucking stupid Margaret. Said she dyes her hair skull.
That's good. No reason. No worries about that. But yeah, I gotta get this fixed. Unless if I just want to buy a whole new suit, which is like for this one, this is a onesie by the way, ain't a suit. But I could get a zip up one, you know, be normal. I actually want this tailored to my size. They probably could.
Fucking stupid Margaret. Said my grandma hooked up with a 20-year-old, JK.
Oh
Sonny.
damn, I thought grandma was
Said
kissing.
stop hitting on someone's grandma, Donnie, so weird.
What the fuck? I'm not hitting on no one's grandma. The fuck? Sonny, Sonny, you have nowhere to talk. You hit on everyone that you see. You hit on your Foxy Fleshy too. If it was talking to you. Bet. Say less.
Fucking stupid
Come at me
Margaret.
like that shit.
Said my grandma said she wants you.
Oh, oh, oh. Andy, her grandma says she wants me. Oh, oh. Fuck. Sorry. I got children to take care of.
Sonny. Said I don't hit on old people.
Cap. I got a child on
Fucking
my
stupid
shoulders.
Margaret. Said and tell Andy that I want him.
Oh,
Sonny.
Andy, the 11-year-old
Said
says
that's
she
so
wants you.
gross.
Oh, he has a girlfriend. My baby. This is my baby. Y'all want to see my child? This is my child. My second child. My second baby. See? It's sleeping right now. That's why it's very quiet. The other child.
Fucking stupid Margaret. Said bro, an elder said that his wife has no more good hips. Fucking stupid Margaret.
My first baby.
Said elderly have no filter.
It's my first baby. Well, actually, no. This is my after. That's my third baby. This is my second baby, and my first baby is this. This is my first baby. This is my first baby. It has my actual baby's collar on it. She passed away. She passed away, so I put a dog tag. A dog tag with the collar. So this is my second baby. This one does not have a collar. This one, they need to get washed. They're all crusty. Because I let my sister, when my sister was still living at my dad's house, her cat used to like bite it and try to hump the damn thing. He would come in my room at night and steal this. But yeah, this collar
Sonny.
has a lot of
Said
meaning.
Donnie, did you know I had blank with my two sisters and my brother a long time ago?
That's something I would not say publicly. I'm just saying. But yep, That's my pup tag. My dog, my tag for my dog. And then my keys. So my keys, number one on my keys is my little chain, my little
Im
my
fucking
little
stupid Margaret.
my little chain.
Said wanna know what's so messed up? Sonny. Said that's how I become fruity. Im fucking stupid Margaret. Said you.
So so here's my chain, my little plushie on my keys. Um, my dog tags. This one and this one. I got this one from my mom. That's what it says on the back. The camera will focus. Come on, focus. I don't. Were you guys able to see that? I don't think you can.
Im fucking stupid Margaret. Said I'm online sexually active.
That's what that says. And then this is a memorial. This is a memorial motorcycle of all the brothers, my buddy, all my friends that are brothers that I've lost in
Sonny.
motorcycle accident.
Said are you and Wolfie planning to have children?
Wolfie is a boy. Anyway,
Im fucking stupid Margaret.
Wolfie is a trans
Said my grandma said
dog.
to keep her in her tomb at 8 a.m.
What? Your grandma said meet her at her tomb at 8 a.m. That's crazy.
Im fucking stupid Margaret. Said room asterisk.
That's crazy. Grandma wants to get freaky. That's crazy. I think this key goes to the safe. But yeah, that's the keys.
Im fucking stupid Margaret. Said tell Andy that.
Tell Andy what? Is this thing all red?
Im fucking stupid Margaret. Said wanna know what's so messed up? Im
Mm,
fucking stupid Margaret. Said you.
damn. Echo, what time is it?
108.
Y'all keeping me up. No, I'm not putting on the mask. I was fixing it. I already broke one.
Fucking stupid Margaret. Said once I peed on a roller coaster.
That's nice.
Fucking stupid Margaret. Said it was called The Hustler.
The Hustler is crazy. I'm gonna put that one
Sonny.
mask back together.
Said bring all the deported Mexicans back to the United States by President Sonny.
That's not okay. Those the at least the bad ones can leave. The ones that are okay can stay.
Fucking stupid Margaret. Said I'll deport myself. Fucking stupid Margaret. Said JK. Fucking stupid Margaret. Said Awik. Fucking stupid Margaret. Said JK. Fucking stupid
I
Margaret.
broke it.
Said Awik.
Yeah, he's broke.
Sonny. Said ban vapes by President Sonny. Fucking stupid Margaret. Said Awik. 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 Fucking stupid Margaret. Said Awik.
Yeah, I'm gonna get this tailored. I'm gonna fix this and get this tailored. Get the buttons removed. Go with a smaller fucking size. Pause, my language. But, guys, it is past the breaking point of my bedtime. I don't want to hear no crying. I already prolonged the stream as long as possible. But
Fucking stupid
I
Margaret.
do have to go.
Said IMASUC. Fucking stupid
That's
Margaret.
crazy.
Said IMA suck your buttons. Fucking
That's
stupid
insane.
Margaret. Said NOOO. Fucking stupid
Well, I got
Margaret.
to.
Said please weary face.
I
Fucking
can't.
stupid
I gotta go to
Margaret.
bed.
Said NOOO. Fucking
It's
stupid
alright. You'll
Margaret.
live. I promise.
Said Nulu.
I promise you'll
Fucking
live.
stupid Margaret. Said please.
I can't. I gotta go to bed.
Fucking stupid Margaret. Said please no. Fucking stupid Margaret. Said please.
I gotta go to bed.
Fucking stupid Margaret. Said I'm lonely. Sonny. Said I. Fucking stupid Margaret. Said I guess this is it. Sunny. Said I guess this is the end of the world. Fucking stupid Margaret. Said can I break the silence?
Really? Really, guys? Come on. You guys will live,
Fucking
I
stupid
promise you.
Margaret. Said YAAA.
I'll do an early stream tomorrow.
Fucking stupid Margaret. Said why?
We'll do an early stream tomorrow. You'll be fine. But I won't. Okay, look.
Fucking stupid
Okay,
Margaret.
look.
Said I'm so sad.
Look. If I can't go to bed, there's no stream tomorrow. I won't do a stream tomorrow. What I thought.
Fucking stupid Margaret. Said pregnant woman.
That's
Fucking
great.
stupid Margaret. Said okay.
Bet.
Fucking stupid Margaret. Said okay bye.
Bye, guys. Bye. See you tomorrow. Promise. Alright. I love y'all. Good night. See you tomorrow. Bye.